Welcome to call the number 237-6196 during public comment. We have 4 issues we'll be talking about, plus a public comment at the end. So that number we'll give out again. So with that, unless council has anything else to say, I'm going to turn this over to our city administrator, Mr. Kukulski, if he has anything to add before we invite, and perhaps invite up Mr. Felton. Mr. Kukulski.
Deputy Mayor, Penny, I'm sorry, did you have something there?
I was just going to ask Mike if he would suggest that anyone who's not a city council member to mute their video.
All right.
Thanks, Mike.
And thank you, Penny. And I'm going to turn this back over to the mayor. The mayor is here prior to Mr. Kukulski's report. Welcome, Mayor.
Okay, thank you, Mike. Sorry for the delay. The woman in front of me at McDonald's, there were 5 other cars that went ahead of us in the other lane. And you did? Okay, all right, thank you. So I did hear the request from Councilmember Rotting that anybody who is on, if you can keep your video off, that allows us all to see all of the other council members if you're not one of the council members as much as possible. Thank you very much. So with that, then, yeah, we'll jump right into our first item, unless, Chris, you have anything that you want to introduce us for before we go to our COVID-19 update from John Felton.
Only, Mayor, that we'll give you, during my admin report a week from today, I'll be able to give you guys an update on the progress for the council chambers for dual usage there, as well as to talk about priorities and goals for 2021-22. But I'll save that for next week and turn it over to John Felton to give our COVID-19 update.
Okay, John, we hope you and your staff had a good holiday season despite COVID-19, but what can you tell us?
Thank you. Yeah, thank you. I hope you all had a nice holiday too. It was nice to be on the downslope for a while, so that certainly made things better. What I'm going to do is just go through. I've sort of narrowed down the slides a bit, and then I'll talk a little bit about the other things going on. So I'm going to start by sharing here. Okay, so does everyone see the first slide?
Yes.
Okay, perfect. Thank you. So this is, instead of giving you the daily ones, I decided to just go with the weekly because it's getting pretty crowded in there. This is Yellowstone County new cases per 100,000 using the 1 week periods, the MMWR weeks that we've talked about. And you can see that we peaked out right about mid-November at over 106 new cases per 100,000 per day. That is about 170 cases a day. We're now down to the range that we were at. We're still above that red line mark of 25 per 100,000 per day, but we're back to where we were 3.5 months ago. When really the increase began, you can see it began that week of September 19th is the first time we went above 25 per 100,000. We went up through for about 2 months. And now for about the last 6 weeks, we've worked our way down. So we're kind of back where we were. So that's good. You know, we were always really cautious to make sure that was a pattern that would persist and not just be a week-to-week thing. We had some holidays in there, but clearly we've made some good progress. When we look at just the number of cases, and this is just looking at a particular day and time, a particular date per month, which is the 20th of the month, you can see that we went up each month from July through November, and then December was the first month we started our way back down, averaging just over 70 cases a day, and in the last month, and we got down to under 2,500 cases for the month. So that was December was helpful. The other thing that makes us feel better that this is really sustained is when we look at our hospital census. So this is the daily COVID. So we need to continue to follow all the regular preventive measures that we all know so well. And then the other thing that I would just mention, Governor Gianforte was sworn in today. I was not part of that, but I did see in the press accounts he intends to announce his plans for what he'll do with what former Governor Bullock had in terms of restrictions. So the masking order, the hours of operation order, limitations, the occupancy limitations. We don't know what those are going to be. I would certainly expect that Governor Gianforte will announce those fairly soon, but at this point they are not announced. So we're still under the current the previous governor's order that the Governor Bullock made, as well as the current health officer order in various jurisdictions. So hopefully we'll get those quickly and we'll kind of know what the next step is. So that's where we are. I'd be happy to answer any questions anyone might have.
Okay, thank you, John, very much for that good news. Despite the good news, we have to always remind people that this is not the time to let up our precautions. More than 1/3 Americans have now succumbed to this disease. And for every one of those, there's been at least 50 who've come down with the disease, many of whom will have long-term consequences of the disease, or at least some, and also take up very valuable and scarce resources in our health delivery system. So we need to remain diligent. With that, questions for John? Councilmember Rotting?
Thank you. John, thank you for the presentation. Just to clarify about the vaccines, are we still on the phase where it's just the healthcare professionals that are getting the vaccines at this time? And then the second question I have is, and that would be specifically for Billings that I'm asking, or Yellowstone County. And then the second question I have is, are the vaccines that go to Billings Clinic, are those distributed by Billings Clinic strictly to their personnel, and then St. B's is strictly their personnel, and then Riverstone Health is considered this distributor to the public? How does that work? Thank you.
So at this point, we are still in phase 1A, which is healthcare providers and others who have direct patient-facing activities, such as EMTs, firefighters, those kinds of folks. So that's still where we are. So at this point, in Riverstone Health, we've only had enough vaccines to work on our own staff. The two hospitals have provided vaccine to people within their organizations as well as outside their organizations. They've had a larger number of vaccines. So phase 1A is not only for the folks working in the hospital at Riverstone Health, it is for healthcare providers. The limitation is that between staffing and the limited number of vaccines, there's a scheduling process that people can come in and they schedule it through the hospital's electronic means, and then they come in to get their vaccine and get monitored.
And if I could add, Mayor, to that briefly, and that is to let you know that I won't say this is everyone, but generally, those firefighters, police officers, and 911 dispatchers who have wanted the vaccine have gotten the vaccine. So we do expect those numbers to increase, and they'll be back in the loop, those who chose to pass, just like healthcare workers. But they have been administered to about 100. Again, please don't quote the number, but about 100 of our firefighters, police officers, and dispatchers who have asked for the vaccine have been vaccinated in that first dose.
Their first dose, correct.
Thank you.
Thank you very much. Other questions for John? Councilmember Neese?
Thank you, Mayor. John, a couple of questions, but let me ask you this. There's been some news about the variant that's been coming across in certain parts of the country. Is there any information you have on that we need to do differently than what we're currently doing with this current COVID strain?
No, the prevention is the same. It's not a surprise that the virus mutated. That's what they do. They typically mutate, and it's sort of a weird term I would use. A successful virus mutates in a way that makes it more easily transmissible. We've always got to remember a virus is simply a parasite. It's not a thinking being. All it's looking for is a cell in which it can replicate. So there's a survival advantage to being more easily transmissible, and that's what viruses do. That's kind of their job, if you will. This vaccine isn't predicated on the genetic material of the virus, which is the way kind of flu vaccines work. So if you think about a flu, when you talk about, let's say, an H1N1 or H3N5, whatever it is, there's these little stalks and then this little kind of ball on the top of that. And those are the H's and the N's. And so as those mutate or antigenically drift, the vaccine doesn't match very well because it's trying to match those H's and N's in that genetic piece. This vaccine isn't the antigen is not the genetic material or the genetic makeup. It's those little spikes that we see on the virus shell. So as long as those stay consistent, the vaccine should work. It's one of we've been trying for years and years to come up with a universal influenza vaccine that's basically built on that stock that those little balls sit on, and it's not been able to be done yet. So again, I always think there's some good. We may be able to get even a better influenza vaccine if this mRNA technology works as well as it seems to. But I don't think anyone should be surprised or see it as unexpected or some sort of failure that the virus mutated. That's just what they do. It really is their job.
Okay, Merritt, and if you don't mind, another question.
Sure, go ahead.
John, you mentioned about the restrictions that may be reviewed by the state. Although the county, you as the health officer have authority in the Yellowstone County, do you anticipate keeping some of these restrictions in place based upon the way you see the spread in our county?
I think it really depends on what the governor does. I think we're seeing some good things happening right now in terms of, as we talked about, test positivity, case rates, hospitalization rates. Those are all good things. We need to see what the governor does and then how we might respond at a local level. I don't really want to sort of predict that because I really have zero intelligence about what the governor intends to do. It is a possibility that under current state law, it does allow that a local order can be more restrictive than the governor's order. But until we know the governor's order, we don't really know what we're going to do.
Okay. All right. Thank you.
Thank you very much. Other questions, Councilmember Purington?
Thank you. Thanks, John. And Happy New Year. Hope it's a better year for all of us. So the question that I have is, in noticing your November 20th situation, is that that's when everything started going down. So that was before Thanksgiving. People traveled, people got together, and now Christmas, and we're 2 weeks out from Christmas. People gathered, people traveled, and our numbers are still going down. I was out and about today for the first time, and I noticed there were fewer people with masks on at the grocery store, which kind of surprised me. But so it just seems like people are starting, I guess, if you will, put their guard down, but yet our numbers are going down. So would you say that's part of the cycle now with this winter coming on, or do you have any supposition what's going on?
Yeah, well, as I said, we're a little early for the Christmas, New Year's implications. We saw there was a 1 week little perk up in the a couple weeks after Thanksgiving, and then we started dropping again. So we did not see a sustained post-Thanksgiving surge, which is good. As I said, we'll know more in the next 1 to 2 weeks what Thanksgiving and Christmas look like, or Christmas and New Year's will look like. I think there are some good signs. The fact that there's a lower test positivity rate does suggest that there's less disease circulating. That helps. I think school being out helps because we know that those kids are more likely to be asymptomatic spreaders, and so they were not sort of glommed together. They certainly gather as kids do, but they're not as compressed. So I think we've been in a good spot, and as I said, the signs all point that way. I really truly am an optimist. But I just feel like we need another 1 to 2 weeks to see, are we really going to see a post-Thanksgiving or post-Christmas surge? What we're seeing now is each different parts of the country have led this. So if we look now at, there was a time when North Dakota, South Dakota, Montana, and Wyoming were 4 of the top 5 in the country. Now we're down. I think when I looked at COVID Act now, the Harvard page today, Montana is 40 something, 42nd, 44th, something like that. So we're seeing our numbers come down. We're seeing other areas. California is way up. Rhode Island was way up. So it definitely moves in waves, and we're on sort of the downside of the wave. Hopefully we stay there. But again, another week or two, we'll have a much better sense of what Christmas, New Year's, if we're going to see a surge or not.
Thank you. Another question or two as we wrap up here. Any other questions from council? I don't see any, John. So again, thank you, and we'll look forward to seeing these numbers stay down. And we've all got our fingers crossed, and we're knocking on wood, and we're not going to let any black cats cross our paths, whatever it takes.
Don't break any mirrors.
No, absolutely. So thanks again, and we appreciate your efforts and the efforts of your staff and all of our healthcare providers in the county.
All right. Thank you so much. I hope when I come back in 2 weeks, we're seeing the trend going the same way. And as I say, we'll keep our fingers crossed. So thank you all. Happy New Year.
Great. Thank you very much. There is an opportunity for public comment on the report that you've just heard. The phone number you need to call if you would like to comment is 237-6196. That's the same number we'll use throughout this evening. There's 4 items on our agenda, after which each one there will be an opportunity for public comment. The number again, 237-6196. Please call that number immediately if you'd like to comment on this item number 1, the COVID-19 update, 237-6196. Call immediately. There is a delay between what you're hearing and the actual meeting. Therefore, it's important that you turn off your computer or your television, or at least mute them, so you're not hearing what is actually behind about a minute of the actual meeting. We'll ask you to keep your comments to less than 3 minutes and tell us your name and your address at the beginning of your comments. Denise, do we have anybody who has called that number 237-6196?
No, Mayor, I've received no calls.
Okay, thank you very much. Then we will close our public comment period on item number 1 and move on to item number 2. Item number 2 is the Beartooth Resource Conservation and Development Area MOU, or Memorandum of Understanding. I'm assuming Steve Simonson and crew are out there somewhere, but Chris Kukulski, anything that your staff or you would like to add before we turn it over to the Beartooth RC&D?
I guess I would just add to, in addition to the MOU, they're going to talk about their annual report, just give you an update on progress over this past 12 months. I'm not sure if Steve or Joel is going first, but I'll turn it over to them.
Great. I do see that we've got Joel Bertolino, the executive director. So, Joel, it's all yours unless you want to do a handoff to Steve.
No, I'll go ahead and start and just kind of do an overview of what we're talking about. My name is Joel Bertolino. I'm with Beartooth RC&D. Steve Simonson's with us today as well. He's our economic development director. Every year we like to go out and we cover 5 counties, and our memorandum of understanding with all of our counties is match money that we use to match against a federal grant that allows us the funds to provide technical assistance in all 5 counties. The federal portion is paid by the U.S. Department of Commerce Economic Development Administration. So we do want to recognize our board members as well that serve on the city council. We've had Frank Ewalt on our board for a while now, and before him, Mike Yakowicz. Both of them have been great board members and put in some time going to our meetings, so we appreciate that. But really quick, just about the MOU, it has a base fee, and then it also has a per capita fee So it doesn't change too much other than the per capita portion that changes as the population changes. So that should be the only change from last year that you'll see. I think we had our county projects attached to that was maybe sent out. We're just going to kind of hit some talking points on those, and anybody that has questions, feel free to go ahead and let us know. I handle a lot of the food and agriculture projects, and we've had several. It's been kind of a busy year with a lot of the COVID funds that came through throughout the summer and the fall. That kept us kind of busy with some of our clients, trying to keep them aware of what was coming out. They've been very helpful to a lot of the clients we serve. We've helped several of them with business sustainability and ag adaptability type grants for those that were affected by the shutdowns, and it really affected their business. We've also had some clients look into the Montana Meat Processing Infrastructure Grants. We received a couple of those for area meat processors, not in Yellowstone County, but they do serve some folks in Yellowstone County that process animals there and direct market their products. So we were kind of happy that was targeted at expanding those businesses, as they were already overwhelmed before the pandemic, many of them. And of course, as we know, the pandemic exacerbated some of that with a huge demand with local processing. So they've been expanding their operations, and I think that's a pretty good thing for everybody. Also on that update list is a RCPP, which is an NRCS grant. It was a 5-year grant, and we're just rounding out the final year of that. And that was to provide, in cooperation with the conservation districts and the NRCS offices in Yellowstone County, Bighorn County, and Carbon County, was targeted at sugar beet producers and barley producers, trying to get them to adopt conservation practices. And it was pretty successful, with several producers in Yellowstone County receiving funds to adopt some water conservation practices, and made them a little bit more productive, I feel like, in those operations. So other than the COVID, we had a lot of interest recently in the Grow Through Ag grants that we do put in for and assist clients with. Assisted Yellowstone Valley Food Hub with a grant there for an expansion. Those won't be notified as to whether or not they receive those funds until February. But it was a pretty busy grant year overall. It seemed like for us, just trying to keep track of all the different things. So kind of with that overview, I'm going to turn it over to Steve. He's been very busy on the EDA side with some pretty good projects here in Yellowstone County. The other thing I'd like to mention is we are really close partners with Big Sky EDA, the local economic development group, and they've pulled us into several different projects, and we've been able to help them out a little bit as well. So with that, I'll turn it over to Steve.
Yeah, thanks, Joel. I think Mayor Cole and I were handing out gift cards together at St. John's to thank employees the last time we got together in person anyway. So with that, we're doing a lot of work on the economic recovery, trying to build resiliency into our local economy, and that's been a big focus of our efforts this year. I want to thank those council members and staff that have also been participating in that endeavor. To that end, we did receive some funding from EDA to help with the economic recovery and to build resiliency into the economy. And part of that money went to Big Sky EDA to help us with Yellowstone recovery efforts. Another part went into a targeted industry study. As you know, that many of the restaurants and entertainment venues have suffered greatly during the downturn and the pandemic. And we wanted to make sure that those efforts were funded and that we work on some strategies to move forward with those businesses. The third leg of the economic stool that we were funded for was an affordable housing study in the region. So we will be doing, we've already started that. Cushing Terrell's been contracted to help us with that. And the ultimate goal of that is to identify not only locations, but types of housing throughout the region, including Yellowstone County and Billings area, on the affordable housing issue that we know that we all have. Mike and Frank, I think, and Pam were also involved with the Jackson Street project to some degree. Other council members may be been involved as well. But we know that we're short 700 affordable housing units in Yellowstone County, and the 70 that were approved, part in Laurel and part through the Montana Board of Housing recently for the Jackson Court project, is really just a drop in the bucket of what that need looks like. So that's going to be a continuing effort over the next year and a half. And with that, I will open it up for any questions you might have for Joel or myself.
Thank you very much, Joel and Steve. Appreciate your efforts. Do we have some questions? Councilmember Tricky and Councilmember Ronning?
Could you, there may not actually be an update to this, but I saw that you listed on here the Southside grocery store feasibility study. Can you give us any additional details on that?
Sure. Council member, we're working with CLDI on that project right now. They've got a building identified as a possible location. Obviously we'd like the private sector to step up, but we've had kind of a vacuum on the south side as far as the grocery stores. And I think it's been at least 3, if not 5 years since the IJ went out, and we just really haven't seen the private sector stepping up. So we think that maybe a public-private partnership might be an answer. Not necessarily a convenience store, but something with a limited merchandise of essentials that could go into that Southside grocery store location.
Thank you very much, Councilor Ronning.
Thank you. Steve, thanks. And Joel, thank you for the presentation. Steve, we often hear about studies that are being conducted, and we often hear about studies being paid for. We don't often hear about work that is the result of a study that has been done, and that there is something that is moving forward because of a study that was done. And this may or may not be something you can answer now, but how many studies are done that you see something actually come as a result of that study? Can you pinpoint that? And when can we expect to see results from some of the studies you talked about tonight? Thank you.
Yeah, thank you, Councilmember Ronning. So for an example of that, we did follow up already with an EDA grant application to look at remote workers and also to build resiliency into, we've got some world-class data centers. I don't know that a lot of people know that half of the iTunes in the country are uploaded from Billings, Montana, and that's because of the speed of our internet here. And we're just not taking advantage of some of those opportunities. So we put a grant into EDA, hopefully that will get funded. We should know by the end of the month on that. But again, council members, that's a way that we can build resiliency into the economy. As we've got a heavy dependence on the healthcare industry. As you know, 30% or so of our area economy is in healthcare, and anything we can do to diversify and create good paying jobs across the region in other sectors is going to be an important part of the recovery. Penny, one of the other things I thought was interesting that we found is those sectors, those places that have a robust technology sector around the country did not see a turn down in the pandemic. As a matter of fact, they saw an uptick. And we've got over 6,000 high-tech workers in Yellowstone County, which kind of surprised me. But again, our partners at Big Sky EDA helped us with those numbers. And so if we can develop that industry further, that's just going to strengthen and build resiliency into the area economy.
Thank you. And clearly the high-speed internet is not in Ward 4. Can we get closer to Ward 4? Thank you.
But some of it is in Ward 1. So with that, Councilmember Shaw?
Thank you. Some of it is in Ward 1. I'm also married to one of those high-tech workers who we moved to Billings, and we're able to make it work here. So we exist. I wanted to ask real quick about, I saw on the list there was help with, it just said Colson Park. Can you talk a little bit more about that and your work with grant funding for parks? Is that something that you guys work on, and you would work on in partnership with the city? I know this is a conversation we often have on council of how can we get more funding for parks and trails. And so really any insight that you might have, I would love to just get a little 30-second version. Thanks.
Yeah, thank you, Councilmember Shaw. So a lot of what we did is just support the work that Patrick Klugman and Big Sky EDA were already involved with, sharing that information, getting that word out, because it's residents across the region that are coming to Billings and shopping and using our amenities. And so just getting the word out a little wider circle that way is always a good thing. We're in regular conversations almost on a daily basis with Big Sky EDA as far as partnerships and planning and what we can do to bring resources to the area, including parks and trails.
Thank you. Any other questions for Steve or Joel? Councilmember Neese.
Thank you, Mayor. Joel, this may be for you. I noticed the revolving loans, you have 400,000, half of them is not funded yet. I'm just wondering what's your available funding amounts that you have available for lending? And then how you mentioned COVID's been pretty hard for businesses. How's COVID impacted those loans, or any of those loans now past due, and you're working with those to get them up to date or anything like that due to COVID?
Thank you. Jelan Knutson is our revolving loan fund manager. She couldn't make it today, but from what I understand, the impact for COVID on our revolving loan fund was mostly like it was for a lot of lenders. We needed to give them a little bit extra time on loans. We didn't really have, of the businesses that we have funded in the past and active loan clients, we had only one, I think, that went out of business, and that whether that was due to COVID or not, but most of them just loan deferrals, that kind of thing that we were doing with them. They did get impacted. Some of them did, but they were able to kind of get their feet underneath them enough to, after a few months of deferral, start making payments again. And that's what we've seen so far. The amount of money in that revolving loan fund, and I'll just start by saying our revolving loan fund is meant to partner with banks, and that's what we do. Jelan has a great relationship with a lot of the local lenders in Billings and in our region. And what happens is if they have somebody come to them that may not have the ideal amount of collateral or credit score and are a little more uncomfortable providing the full amount that they ask for, a lot of times we can come in and take the higher risk portion and still get that deal done. So that's the intent to that revolving loan fund. I was a little surprised with that we have had still businesses contacting our revolving loan fund looking to expand or to start new businesses. And I think she's working on 3 or 4 right now for the next revolving loan fund meeting. So that was kind of interesting to me. I wanted to see if there was going to be a complete pullback like we saw kind of in 08, 09, and it hasn't really happened for our loan fund from what we've seen anyway.
Okay, great. Thank you.
Thank you. Anything else? Councilor Purington.
Thank you, Joel and Steve. I guess my question goes back to what Roy was asking, is the availability of funding. For 2021, your dues would amount to a little over $51,000. So are you guys making money with some of your projects that it actually goes back in the till, or is most of your money, it's based on dues and it's going out? I don't really understand the dynamics of what you guys do financially.
A lot of what we do is, like I said, the funding and the calculation of the dues that you see here that spread across our 5 counties is to match the EDA grants. And so what that EDA does, it allows us access to their funds, like the 2 grants that Steve's talked about that he's working on. And those are a lot of times larger grants, a couple $100,000 sometimes. But also, we do have money available in our revolving loan fund, and it's up to $250,000 per business that we're able to provide. And so we do provide assistance and help write grants or loans. The Grow Through Ag grant that I talked about is also a loan. And so we provide access to our clients for grants and loans that they're eligible for. That's the short version.
Councilor Purington.
Okay, so I guess back to the other question. So what is the bottom line of how much money you guys have? Because if you're only collecting $51,000 a year for dues, I don't understand how you have the $250,000 plus for a loan. So I guess I'm still not clear on how your business is conducted.
Okay. So each one of our programs are separate. So Steve works the EDA program. My funding comes through the Department of Agriculture, and that's why I work mostly on Department of Ag type projects. Our revolving loan fund was started with 4 different loan and grant sources. And again, this is more Jillian's area, but I'll do my best here. That was started approximately 20 years ago. And so the idea was that we do have loans there that we took out through EDA, through the intermediary relending program through USDA, and through, I think, Montana Board of Investments. And we take that money and we relend it out to available clients to help projects move along. And that's a separate pot from some of these other things. So this is not our total amount of funding that we operate with. This is just the portion that matches the EDA program.
Okay, thank you. Last question, Councilor Purington?
Yes, and just one quick follow-up. So with the 4 different counties, and I know, they give accordingly to their population, how does that spread out with when these grants are applied, and do you do it kind of on an equal share, regardless of how many people they have in their county, depending on the need?
It's based on demand primarily. So we advertise our services. We work through our board members and through county commissioners, and even through the programs that we operate under, like EDA or CRDC. And they send us those people that are in need of help. And we also have a pretty good Facebook page, and we try and keep that active as far as when things come available. So, but generally the bulk of the clientele that we help come from the most populous county. Naturally, there's just a lot more going on there. So really it's a need-based kind of system, just like any other type of government or nonprofit, where they come to us a lot of times by referral from other entities and partners.
Okay, thank you very much. Steve, if you want to follow up on that, and then we'll go to comment.
I was just going to add to that of the $400,000 EDA grant we got through the CARES Act, half of that went to Big Sky EDA to help with the Yellowstone County recovery efforts. So part of that was based on economic impact. Part of it was based on population. Obviously, the housing study and the targeted industries are also impacting Yellowstone County. And so dollars are going into that of the $400,000 total award that we got. But half of it went directly to Big Sky EDA to help with recovery efforts.
Okay, thank you. Let's open up for public comment then for anybody who might be listening. If you would like to comment on this item, please call that number 237-6196. That number again, 237-6196. 6196. We'll ask you to keep your comments to less than 3 minutes. Tell us your name and address. And please turn off your television or your computer, or at least turn off the sound, because the actual meeting is ahead of what you're hearing, and it'll be very confusing if you don't. Just as a reminder to the council members, this is not an action item tonight. We'll be having the MOU, the Memorandum of Understanding, with Beartooth RC&D on future business agenda for actual approval or disapproval or other debate. That number again, 237-6196 for public comment. Denise, has anybody called 237-6196?
No, Mayor, I've received no calls.
Okay, thank you very much. We'll go ahead and close public comment and move to wrap up this item. Chris Kukulski, you turned your camera on. I wasn't sure if that was because you wanted to comment on anything related to this item.
I think you kind of described it. I mean, our intent here, this does report come to you annually. Then we do bring it on the agenda, consent typically, unless there's some kind of an unanticipated or anticipated problem, to continue our partnership. And ultimately, I got to talk to Steve Arviscow this morning. As Steve and Joel mentioned, they're a strong partner with us. And ultimately, there are both direct and indirect economic benefits to partnering regionally, and that's really what this is. So as I look at our roughly $12,000 investment as a partner, I think it's a wise investment, but ultimately the 11 of you need to make that decision. And unless I hear otherwise, I'll put it on an agenda for your guys' approval. Thanks.
Okay, thank you very much. That then concludes item number 2. Joel, Steve, thank you for being with us. Stay safe. Councilmember Neese, before we move on to item number 3.
Thank you, Mayor. I was going to just give Chris some feedback. I agree with what he said regarding it's a good benefit. I would just ask that maybe when we get these annual reports, we have some maybe some kind of financial report that shows the organization's size, what they do, what their money, things like that. So I think that would just help to give we don't need a 50-page annual report, but just a summary, kind of like we do with the TIF districts. So it would be appreciated.
Okay, I saw a thumbs up by Chris, so he got that. Okay, let's move then to item number 3. Not everybody in our community benefits from economic development. Some are left behind, and some are left on the streets. And that's part of what item number 3 is about. Yellowstone County Continuum of Care, specifically the Emergency Low Barrier Shelter discussion. This is an update. We've got several representatives from the Continuum of Care, which is a consortium, and I'm sure our presenters will describe more about who they represent and the organizations who are involved with the Continuum of Care. Chris Kukulski, anything before I turn it over to Cody or Craig or whoever else is with us to lead this discussion?
I'll just emphasize, and Cody, I see he is here. He's got a presentation to work through. We received an email late this afternoon. I had a few different conversations today from Patty Webster, and it just emphasized where we were when we put this agenda together and where we stand tonight, which is this annual update of where things stand versus any kind of an ask this evening. So, Cody, I'm going to turn it over to you and let you run with your presentation and your update.
Thanks, Chris. And thanks for having us tonight. For those who don't know, I'm Cody Christensen-Linton. Tonight, I'm representing the Downtown Billings Alliance as the Resource Outreach Coordinator. I know there was some confusion about that as well on who I was here for tonight. So I figured I'd put that in first. So first of all, I would like to just let you know that we're here tonight to really celebrate everything that's been accomplished so far with the Low Barrier Shelter. With that, we started earlier this year on a planning for a low barrier shelter. As that planning was going on, we saw the need in the community to have more of a rapid response. With that, we had a small work group that came together in August to basically build this from the ground up. Obviously, this isn't something we've had in town before, so we've really just been building it off of best practices across the nation. So it was a lot of meetings, but we're excited to get that up and running now. So I will start sharing my screen for the PowerPoint. And I've been reminded to talk slow tonight because I tend to rush through and talk quick. I'm a very excited person. All right, so for the COVID Response Low Barrier Emergency Shelter and Q&I site. So for those who don't know, Q&I also stands for Quarantine and Isolation. So we've absorbed that site from Riverstone as well. All right, and then here you can see the timeline as well. Started in March all the way down to October. The low barrier shelter the emergency response started being planned in August. You'll see here that the timeline for October is in there as well. The quarantine and isolation site actually opened October 31st, I believe, and then the low barrier shelter was November 17th. So they started at different times. Here's a picture of where it's at. The Western Inn Motel, which is on the corner of 33rd and 2nd Avenue. You can see that there's 40 rooms. This gave us the opportunity to have both congregate and non-congregate care. The rooms came fully furnished. There was security cameras at every door. So this was really an awesome find. It is now owned outright by Hab Development. And after the emergency response shelter, which is only going to be here for 12 months, ending next November, while this is running, we're also going to be planning the long-term low barrier shelter. After this is done, though, the Hab Development can use this for ongoing housing activities.
And Cody, I don't want to interrupt, but maybe you could just explain what HAB Development is, since that's an acronym, I believe.
The Housing Authority of Billings. Yep. All right, and then just another picture from it. You can see that some of the rooms have entrances on the outside of the building, and then there's also entrances on the inside of the building for most of the rooms. Okay, and the operational plan for the COVID quarantine facility. This will serve all vulnerable populations who need quarantine space. This gives us that opportunity to help out more people in Billings in the community that don't have that availability. They have to be referred through a medical provider only. So nobody can self-refer for the COVID quarantine and isolation. That has to be referred from the hospitals. The COVID quarantine is obviously only non-congregate care. We're not going to be rooming them with other people. If they're a family, they can stay together. But the COVID portion of this also has up to 20 rooms available. So that gives us access for 20 families in reality. The guests can stay 24/7, and we'll have 3 meals a day delivered from Salvation Army, which is amazing. Healthcare for the homeless will be coming to check on the guests periodically. And I know that was another question. Healthcare for the homeless is from Riverstone Health. So that's their healthcare that is anything from periodic checkups all the way to they have licensed addiction counselors on site as well. And then it'll also be a point of intersection for other community services if needed. And then the low barrier, I'm going to get that up here. There we go. The low barrier emergency shelter. This side is also serves virtually all persons in need. Anybody that cannot be served at another site. So if they're not able to meet the criteria at the Montana Rescue Mission, the Women and Children's Shelter, or the Crisis Center or whatnot, then they can stay at this site. Low barrier is the term we're using because this is not a no barrier shelter. A no barrier shelter would mean that we would serve everyone no matter what. For this being low barrier, it's because there's no pets allowed. And then sex offenders may be barred from entry as well. So this will all go through the Community Crisis Center for diversion. So they'll be the ones that decide on if they can come to this site or not. it'll be operating, the low barrier side will be operating 7 p.m. to 7 a.m. daily, and they do have to leave their rooms every day. It's not something that they can just come every night and have their room waiting. The low barrier side will also have congregate and non-congregate options. People who cannot stay safely in a room with other people will be placed in their own rooms, and then if they have the ability, they'll be placed in congregate space. There are no services provided at this facility. We want to make sure that that's clear, that we're not duplicating any services in town. We do encourage other providers to reach out and then come to the shelter if available to do outreach, but we will not be creating any services that'll be here. The Community Crisis Center will serve as that primary front door, which that's the group that will be referring to the low barrier shelter. So that everybody that comes to the shelter has to go through the Community Crisis Center. So they are the ones that decide if they can go anywhere else. They'll put them through the system where they can see if they meet that criteria for other locations first. Okay, and then desired outcomes, a reduction in the amount of time from facility admission all the way to housing. So that's our goal with this, is that we want to give that option to meet people where they're at, stabilize them, and then get them into a program that can get them back into housing. So we definitely don't want to use that term where we're enabling people. We are holding them accountable and wanting to meet them where they're at in a way that we can encourage them without forcing them into a program. A reduction in the use of emergency department services and in law enforcement encounters. That's a big one too. The law enforcement has been working with us as well from early on in this planning, so they know that they can bring the people to the Community Crisis Center as that main drop-off point. So then the Community Crisis Center can put them through the system and then see if they can go to any other shelters or if they need to go to the low barrier shelter. Identification of previously unserved individuals. So with this, we're wanting to make sure that we collect as much data as possible, because we want to be able to provide those numbers. This is something that we haven't had in the past. So again, we're building this from the ground up. So we want to make sure that we are collecting as much data as possible to bring that if we need it. We will need it in the future, but then we'll have it available. Additional benefits with the low barrier shelter, improved public health outcomes. So with that, we were able to serve more people with this quarantine and isolation site. Previously, obviously, it was at the Metra, and then there was the, I guess, quote unquote, man camp for Riverstone before. Those didn't have non-congregate care, and they weren't able to serve families, and it was not ADA, which this place is. Backstop for existing providers who need to limit overnight stays is another option. They'll be able to contact us. We will receive referrals from other locations as well, but they still have to go through that primary front door, which is the Community Crisis Center. Improved coordination of services. So this is something where all of us work together, but this is something where my job specifically would step in. I can go to the low barrier shelter and talk to the people that are at risk, and then do that outreach and engage with them a little more, refer more people to this shelter that aren't aware that it's even exists yet. So that's something that we've also been working on to just get more engagement and reach more people that have not previously been helped from the continuum of care. Again, reduce duplication of services. So that's something that we want to really focus on, is that we're not creating any new services. Additional opportunities to engage with homeless. Again, that's where we're reaching out to more people, where we can collect better data to represent what's really happening in Billings. Again, real world data on need for low barrier shelter. So that's something we're still building off of that best practices model from across the country. Okay, the memorandum of agreement. So this is, you'll see the participants of the original work group that started in August to build this low barrier shelter. The only one not listed is Montana Rescue Mission, who was involved, but they have since wanted their information removed. So you'll see in here, I mean, the Housing Authority, HRDC, Billings Clinic, Crisis Center, all the way to BSA Integrity Consulting. So it was a good group of people, and it was amazing to see everybody come together because they saw the need for this, and that this is something that we don't want to duplicate services. We're not competing against each other. We're really just trying to work together to solve a problem in Billings. You'll see that Rimrock joined the staffing and client flow planning later on, along with participants all responded to a request for interested parties to engage in planning. So everybody from the continuum of care was originally invited to join this work group. It just kind of boiled down to who had the availability because we were meeting very often. All decisions were made by a consensus agreement. So we literally didn't leave the room sometimes until everybody agreed. So there was a few late nights. Let's see here. The MOA, it addressed the population served, facility location, scope of services, all the way to the data gathering. So, I mean, we really focused on every aspect that was possible. We do know that this will be non-binding and that it will evolve over time. We know that since this is something that is new to Billings, that we're going to have to adjust it to fit Billings. Okay, key decisions. You'll see that the oversight is comprised of the COC Executive Committee. So we wanted to make sure that not one organization specifically was running this shelter. So it's something that this is more along the lines of the Continuum of Care Low Barrier Shelter. We're calling it Off the Streets. The participant group will continue to meet monthly for additional coordination and guidance. So that's something we've been focusing on as well, again, to make sure that we are updating things when they need updated. Operations will commence that's outdated, obviously. The quarantine and isolation side started October 31st and the low barrier shelter on November 17th. Let's see here. The monthly budget you'll see is estimated at $150,000 a month. That is for both sides, so including quarantine and isolation along with the low barrier shelter. Funding organizations will either direct purchase goods and services or use United Way as a fiscal agent. And then the intention decision is to keep the project as a community-led effort rather than a single organization, like I said. And then you'll see the sources of funding we've been currently using are FEMA funds, ESG funds, donations, and collaborations. Let's see here, but we'll still, obviously we still need that community support as well. And the county support for the FEMA has to go through county DES office and state DES office. All right, important takeaways. The project is designed to serve the entire community and benefit all COC members. So again, we want to make sure that everybody knows that the whole COC was working together on this as a team and a group-led effort rather than competing against each other. The goal with that is that we're improving the public health. There's more services. With having this at one location, we're able to refer people to the proper service that works best for that individual rather than referring everybody to one shelter or one location. With this not having any services at this specific location, we're able to refer them to the one that best meets their needs. And again, that's through outreach and additional opportunities for engagement. We're inviting the other community services to come to this location as well. The project is intentionally designed to be temporary, emergency response driven, and fact finding. So again, this is only a temporary location at this specific spot for the low barrier shelter. So it will be 12 months, which will be ending next November. The fact-finding portion of that, this is back to, we're really focused on collection of data so we can have all of that information available and see really what is happening in Billings and have all of that information to back it, especially when we're building a long-term low barrier shelter. And the project has access to funding, but still needs partner support, FEMA application, and pass-through agency. All right. Let's see here.
Thank you very much, Cody. Would you like us to just open up with questions, or did you want to turn it to Craig, or how would you like to proceed?
We'll I'll see if Craig has anything to add. I do know that we also wanted to celebrate that there's been by December 31st, the shelter has served over 160 unique individuals already. So, Craig, did you have anything to add?
Thanks, Cody. I appreciate that. And thanks, Council, for letting us present tonight. I think we do have a lot to celebrate. This has been such a wonderful opportunity for all of our agencies to come together in the social service sector, just to work together to see this thing happen so quickly and so comprehensively. So I just really want to give a shout out to certainly Have Development Corp and Patty for purchasing that hotel. Riverstone Health has been just phenomenal in the expertise, the guidance, and the help that they've given us as well. But I just really want to conclude with just saying that this is really what can be done when agencies work together in transparency and honesty, and just work to do a little bit better for those on the street. It really has been a nice thing for our homeless in that they are getting 8 to 10 hours of sleep each night. They're exhausted. I don't know if you know, put yourself in place of a homeless person, but you spend much of your day just figuring out where you're going to sleep tonight. And it's very stressful. And so we really had security was one of the first things that we had talked about. We needed security. We saw the homeless as maybe coming there and thinking this was going to be a party or something at the hotel. And one of the surprises that I found was that people were checking in at 7 p.m., as Cody mentioned, and by 8 o'clock, they're asleep. By 9 o'clock, they're certainly asleep. And so it's just really been nice to see people getting a good amount of sleep and the difference that makes in their lives each and every morning. I happen to be on the morning shift, so when I see them in the morning, they're up without much effort at 6 a.m. And they're smiling, they're happy, they're hopeful. They're looking at it as maybe today's the day I beat my addiction, or today's the day that I work on housing seriously, or today's the day that I do get off the streets. And so there's just one little piece of sleep and respecting people's dignity. I mean, we're all fellow human beings, and just respecting those folks has been just a blessing to the homeless and to our community. And one last thing I would say is we've done some other things that have been really nice at Off the Streets. One of our goals was to get rid of the shopping carts. So as you're driving around the city of Billings, I want you to notice that hopefully you don't see any shopping carts. That was one of our goals. And I think as I've driven around looking, I haven't seen a shopping cart in a few weeks. So that's all I've got, unless there's other questions.
Okay, thank you very much. Cody, we're going to go to some questions now, if we may. Appreciate efforts of the continuum of care. I'll just start with a couple questions, Cody or Craig. Two things. One, how can the community support the effort, individuals? You said you're always looking for supporters and partners, and that would include financial contributions, of course, but also legally, this is interesting. There's a continuum of care, which is a consortium, but somebody, presumably some legal entity, is contracted with Craig to hire and who's promised to pay him. Who is that, and what's the legal structure here when you've got all of these parts, but doesn't it have to come together in some sort of legal entity?
I'll take a stab at that. So I am paid through a grant that was written, or that Riverstone Health so generously sent the money to United Way, and so they are paying my wages through, as Cody mentioned, United Way is the fiscal agent for the low barrier shelter site. So that's how I'm being paid. It is a little bit challenging to have all these different moving parts as far as the funding. I'm not sure that we really know at this point in time the funding piece. I think we have some conversations to have with the county regarding FEMA funds before we really can talk about the needs that we'll have at Off the Streets.
Okay, thank you very much. Other questions? I saw some hands. Council Member Purington and Council Member Cheriki.
Thank you. And Craig, Cody, Patty, I agree. This has been a long time coming with the continuum of care with the different social services working together. And I think that's amazing. I had several questions. Patty addressed those, and I think Cody even kind of addressed some of those. Why 1 year? Is that the FEMA funding at this point from year to year? I'm just going to kind of lay out what I'm going to do, and then Patty, you probably addressed most of these. $150,000 is a chunk of change. And so how is that working to maintain that? And then last but least, with having served as many as you have, and Craig, you mentioned that it's gone pretty well. They seem to be sleeping in, because that has been a main concern of mine when you have a certain population that gets together, that you wouldn't have some issues. But it sounds like, I guess at this point, it's done well. So again, congratulations on, starting this. We'll see how it works. I'm hopeful. And I just, I think the funding kind of scares me. But anyway, so I'll give it to you. Thank you, Patty.
Pat, I'm going to introduce, or at least let Patty Webster, Director of the Housing Authority, introduce herself and comment as she would like. And if you want to jump in on Councilmember Purington's questions as much as you can. So let's listen to Patty. Patty, it's all yours.
Hi, thank you all so much for giving us, can you hear me?
Yes.
Yeah, thank you so much for giving us the opportunity to come in and just celebrate with you, because we are so excited about this project. Sorry, I've been very ill, and this time of night is super hard for me. Keeping my mind on track. I have the COVID thing going on here, so I apologize if it seems like I'm scattered. I'm not trying to be dismissive to you or any of your questions. One thing I just wanted to bring up, Pam, you asked some very thoughtful questions, and I just appreciate the opportunity to speak to that. I kind of forgot already your first thing that you said when you started speaking.
Why 1 year only? And then second, how is the $150,000 a month outlay going in your ability to cover that?
Thank you. So one of the things I just wanted to correct, and it's my fault in not updating the slide, we originally thought, based on the information from the other shelter providers here in town, that it would be $150,000 a month. Our reality has been $85,000 a month. So good news for that, right? It's like half the cost. The other thing is this was stood up only as an emergency response to the pandemic. This was never meant to be a permanent solution to what was needed. As you know, because many of you participated in this, the COC has been, we've just finished up our strategic plan. It's just been delivered to us. And so Jennifer Owen facilitated that for us, and we now have our actual strategic plan. But we never dreamed that that this would be more than 12 months ever. It's never been intended for that. We also know that there are other agencies in town that are working on trying to create just that same thing. And whether that would mean serving the low barrier, we need to work with that and with our other community partners to ensure that there isn't a duplication of services for sure. So that's why only the 12 months, Pam. The other thing is, when you talked about being nervous about the funding, there's an opportunity right now because of COVID that there's specific money available only for this exact issue, right? Both sides. And so ESG funds that have come through HUD and CARES Act funding are only available to do specific things. So HRDC 7 is the recipient of the ESG funds. There's 12 different field offices of HRDC organizations across the state. And so they receive those funds directly from DPHHS from the state. And they can only be used for this exact thing. They can't be used for congregate housing. So for like the Q&I side, they specifically want us to prevent spreading the virus. And so we need non-congregate housing to make that happen. Individual hotel rooms made sense. We did not want a nightmare like what happened in Missoula. They spent, I'm not throwing Missoula under the bus by any means, but I'm just saying what their reality was. The city bought a hotel to be used for COVID Q&I. And I think you all read the articles in the paper, right? It was a bug-infested, disgusting thing. And I don't even know if they have it up and running still. So the Housing Authority of Billings instrumentality, our development instrumentality is HAB Development. We're a complicated group. Mike used to be on our board, so he understands the complexity of a housing authority. But we are a public agency, and our development arm, through the board approving this, purchased the hotel and purchased it knowing what we were going to do with it, right? Turn it over to the COC to let them use it for this community need, which was an emergency response to the pandemic. We saw what was happening. Just for some budget numbers, when the county was operating the quarantine and isolation site at the Metra, and that's all they were operating was the Q&I site, that was a $250,000 a month price tag, just for Q&I. So I am just so excited that my coworkers in the community here have been able to stand up something like this. And those numbers are just amazing, right? That we have served 86 unique guests on the low barrier side and 74 unique guests on the Q&I side. Families could not be served before. Handicapped people could not be served before. We're serving them. It's kind of cool. Just the other day when Sean Hines and I from Riverstone were meeting over there with Craig, I could hear children. And I'm like, I thought it was a cat or something. I said to Craig, do I hear children? Because again, my mind. And he said, yeah, there's some families here right now on the Q&I side. And, the structure of the hotel where you can have adjoining rooms. So the sick person or persons can be in one room and the family part can be in the other. And the whole thing of the non-congregate having separate bathrooms and separate showers. So we're able to do that. And it really has been just a super win for our community when you see those numbers. I mean, we were surprised. And again, that's why we're so committed to gathering the data. One of the reasons I want to point on for the Community Crisis Center being that main friend, we heard loud and clear from the police, and I think Mayor Cole and Chris, you were both at that meeting. They want one place to bring people. They don't want to go someplace and then them tell them, now you got to take them to the next place, and now you got to take them to the next place. Our police department doesn't have time for that. So the Community Crisis Center has the capacity of their staff to do that medical and medical meaning physical and mental health assessment to see where it would be most appropriate for them. If they truly are in crisis, they need to be at the crisis center. If they don't meet the eligibility of the rescue mission or of the YWCA or of the family shelter, then off the streets is the place. Our goal truly is that we're not going to have any articles in the paper saying that there's been another homeless person died because they froze to death, or that we have another homeless person crushed by a garbage truck because they were seeking shelter inside of a trash container. And when you look around at the continuum of care and the organizations that have jumped on board on this, it has just been amazing. How lucky for our community that Craig was leaving St. Vincent de Paul and was able to work with this group to serve this population. He has a very unique relationship with homeless people and how he can interact with them. And that's a gift. That's a gift we all don't have in the community. Many people interact with fear. And I'm just so proud, and I hope you are all proud that your coalition, your community of care for Billings and Yellowstone County has done this for our community. Just super excited. So really excited.
Okay, thank you very much, Patty. There were some other hands up. Councilmember Tricky, Councilmember Ronnie, Councilmember Joy, did you have your hand up also? You did. Okay, so Councilmember Tricky, Joy, and Ronnie.
Thank you for your work on this. I'm honestly very amazed at how much progress you made in such a short time. I'm just curious about the word congregate. I know it's used in a lot of different ways, and I'm just kind of curious what it means in this setting and how you're doing it.
So it means separate spaces. So congregate care for sure for Q and I. You're trying to give people the provide the place for them to either isolate or to quarantine, and that needs to be in a separate room. The Metra, it just had curtains, so clearly a virus could spread through there. And then at the man camp, they had individual bedrooms, but all the rest of it was shared space. So it did not meet the requirement of FEMA. And we're looking at those things, right? The FEMA definition. So it's separate space is what that means. They need to be alone in their own space.
Okay, thank you, Councilmember Joy, and then Ronnie.
Thank you, Mayor and Council, and congratulations. I am so happy for this development. So much hard work has been put into this, and to be able to talk across silos and not have that siloed response is just amazing. And I'm sure that's part of the reason that you're able to do this at such an effective level, at such an efficient level. So congratulations. I had just one question. At the beginning, I heard kind of rumblings. How does the neighborhood, is the neighborhood accepting, and how is that working with your neighbors? Thank you.
Thanks, Denise. So as you know, it was very important for us to meet with the neighbors in that area. And we did that a couple of different times. And we wanted to hear from them what their concerns were. It's really surprising that the majority of the neighbors did not want a fence around that structure. That was one of our initial ideas, was to put a fence around it, because we know that it's uncomfortable for people to see homeless, but they didn't want that. Only one person wanted it. And so it was really interesting. And I'm going to let Craig speak to the other thing, but to my knowledge, we've had absolutely no issues at all with neighbors, but I'll let you speak to that, Craig.
Yeah, thank you, council member. Yeah, we've not. We've asked all of our neighbors to be. We came at this from a good neighbor approach, and gave out our numbers and said, if you ever see anything, hear anything, any concerns, small or great, let us know. And we've circled back with some of those neighbors since we've been opened, and they're very pleased. You can imagine they pictured 20 or 30 or 40 people walking down the sidewalk, and they have businesses they're trying to run. So you can see why they'd be concerned, but that just isn't the case at all. We do provide transportation to and from the shelter, and so you're not seeing a lot of people walking on the street. A few still choose to walk, but most of the people are being diverted through transported by a van that was donated to us to the agency they need to go to. So very few people walking around. Neighbors are very happy.
Yes.
Great. Thank you. Councilor Barani.
Thank you. Thank you all so much. I echo what Danny and Denise have said. This has just been such an incredible community effort, and so grateful for that. And truly grateful to have been a part of what you were just talking about, the continuum strategy for the continuum of care. I have been so impressed with the work that I've been able to be a part of, and watching, and excited for that presentation to come to us as well. So thank you. Craig, you said something powerful about sleep, and I agree with that. That is such a powerful statement that you made. I have a question about hydration, because I think hydration is also a critical element to the health of people that are on the street. So would love to know how that hydration, if hydration is a part of what's happening here. But I do want to take the time also to compliment you, Craig, and the rest. you are a gift to this community, Craig, and you and I both know that I have a family member that has been on the streets in Billings for over 20 years. And she's been trafficked and prostituted and battled drugs. And her involvement under your leadership at St. Vincent de Paul is what has gotten her into housing. And you know that. And I could not be more grateful for the work that you do. And what was said is that you meet people on the street where they are. And that is something that had kind of been missing from Billings. And thank you for bringing that to our community and for really opening up that door to all of the other organizations to continue to move in that direction. And I hope that all of them will continue to move in that direction. So thank you for that. Thank you for the opportunity that you are giving us to recognize our unsheltered population as worthy of public safety as our sheltered population. And this is part of being able to provide our unsheltered population safety in the night as well and in the day. So I look forward to hearing again more about the long-term plans. But thank you, Craig, again. And if you could address how important, along with the sleep factor that you stated, the hydration factor in regard to keeping people healthy on the street. So thank you.
Craig,
Yeah, well,
Craig, as you're answering Councilman Roning's question, will you talk about just shortly and briefly the process? And so what else is happening for folks there besides hydration and sleep?
Yeah. Thank you, Patty, and thank you, Councilmember Ronning. Appreciate your kind words. So hydration is part of what we do. We do not provide food or drink at the shelter because people can be fed at other places. They're checking in at 7 p.m. And exiting at 7 a.m. So there's not really a need for food. Plus, there's places that are providing breakfast, lunch, and dinner to the homeless population. But they are given a bottle of water, and water is made available to all people. They can have water in their rooms. We are not a 5-star hotel. I joke about it as they're leaving each morning. Make sure you give us 5 stars when you check us out on Facebook. And of course, we're about a half a star is all we are. There's no TVs in the room. There's multiple beds in the room. We don't pack people in like sardines, but we do put as many people as we can into those rooms. But they are given a bed to sleep on with sheets and a towel to take a shower and soap and shampoo and those hygiene things that you need just to feel good about yourself. The other thing that was kind of a nice thing is that we offer to do their laundry for them while they sleep. So as folks check in, we just ask them if you would like us to do your laundry. Most of them will say, yeah, I would like my clothes. I haven't had my clothes washed in weeks, and some have been months. And so we do provide that service for them. We loan them some pajamas so they can ideally take a shower, hop into some PJs, and then we launder their stuff with staff throughout the night, and then they're returned clean clothes in the morning. And again, that's just been really a nice thing to see them leave in the morning, showered, refreshed, hydrated, with that adequate amount of sleep, which is at least 8 hours. I think it's more than that when you carry that much stress around. But they're ready to tackle the day. And I can't tell you the number of people that have said to me just in the short time we've been open, Craig, today's the day. Today's the day I'm going to meet with my counselor. Today's the day I'm going to meet with my addiction counselor or my mental health counselor or my housing person. And so we're really seeing a significant impact in their ability to cope with their bigger challenges. They've had so much time in the day, as I mentioned before, stressed by where they're going to sleep tonight or what they have to do where they sleep tonight, that they don't have a lot of time or energy, bandwidth to worry about those other things. They kind of blow them off. So this has been really a good thing. The other thing I would point out is the Community Crisis Center. We don't talk about them near enough. They have been just an invaluable agency for us. As Patty mentioned and Cody mentioned, they're the front door for people coming into the shelter. But if you can imagine the Community Crisis Center pre-COVID could only hold about 45 people, including staff. And so they would have people taking turns. So if you know much about the Community Crisis Center, you sleep for 4 hours in chairs typically. And then you're asked to step outside and sleep out and stand up outside or sleep on the church pews outside while somebody else that was outside comes inside. So you're doing this back and forth all night long. And you can imagine what happens to your sleep. You don't get any. So it really is it's a difficult thing for people. The Community Crisis Center was never intended to be a low barrier shelter, but that's what it turned into. And so the people that were truly in crisis, as Patty was mentioning, really didn't get the help that they needed at the crisis center because there were so many people to see and talk to. And so what we've done with Off the Streets is that we've taken we've served. We're not trying to serve the most people, but we certainly have been surprised that we've already had a high December 30th at 39 people in one night. And so what that does is that puts 18 to 20 people at the Community Crisis Center who truly are in crisis and need the medical attention that they can provide up there. So it really is a win-win when you look at it as a community effort for our hospitals, for our Community Crisis Center, and certainly for the homeless. So I don't know if that answers your question or not, but we're taking good care of them.
Thank you very much. Other questions for Craig or any of our presenters? Councilmember Yakovich and Councilmember Shaw.
Thank you, Your Honor and Council. And I first I have a question, but first of all, I did call about 3 business owners in the neighborhood, and they were very happy because I attended initial meetings with you, Craig. That they're very happy that there's no fence and no tents. So that was really a concern, and I appreciate you listening to them, and I hope that does not happen. And also they have indicated that it is good that they come in at 7 and gone at 7, and it's provides clarity for that neighborhood. And it was a minor point, but one did point out a noticeable increase in people, 2 to 5 people, people who weren't there before walking the neighborhood. So that was what I got from my neighbors, from those neighbors. But I continue to be concerned of duplication of resources. I'm concerned that the Montana Rescue Mission is kind of not talked about. But really something that I'm hopeful that ultimately we get to that as a low barrier and a shelter. Duplication of services, I'm not an expert on, but I do know that they don't allow pets and sex offenders. So they're looking for somebody who would maybe do that. Well, I can't speak for them, but I'm thinking that way. Likewise, so my question would be, in that duplication of services, I hear, I don't know how correct that is, but my crisis center a year ago would send all their people, maybe, or a majority of their people, to the rescue mission. Now they're all sent to your place. I'm really, really good about the quarantine. That's clear. We need that. And 70 people, whatever, go there. That's cool. But this other part, I'm just worried that we're duplicating services. You are doing exactly what they're doing, and I'm worried that will just weaken our actual long-term goal. So go ahead and answer. Cody, I'd like to get your thoughts on this too.
Yeah, the one thing I definitely wanted to touch on was how you referred to Crisis Center a year ago. They actually didn't send them to the Montana Rescue Mission. I actually helped them start something called My Backyard, which was their overflow, and where volunteers were collected and they housed them in local churches downtown. I guess a few people may have been sent to MRM, but generally speaking, the overflow were actually sent to My Backyard. And as far as duplication of services go, I think that it's important to say that with this specific site, it's not duplicating any current services. Long term, it would be great if we could get Montana Rescue Mission to create that low barrier shelter like we've been talking about. And I also think it's important to also know that the Rescue Mission was involved with this planning. So they do know what we were working on throughout that entire planning process. Patty, do you have anything else to add to that?
Sure. Thank you so much for those questions, Mike. It has been our number one goal that we would do diversion. We have a very complete diversion protocol. So when people present at the crisis center, the crisis center staff is trained to do that full assessment and to divert the people to the most appropriate shelter. So if they're eligible to go to MRM, that's where they go. If they're eligible to go to the family shelter, that's where they go. If they're eligible to go to the YWCA, that's where they go. The reality is that there are a lot of people who are not eligible. Even though MRM has opened up what they're calling an emergency shelter, there are still criteria that people have to meet in order to be able to go there for the night. What I understand is they're given a mat and they're allowed to sleep on the floor. They don't have a pillow or a blanket or anything, but they are inside for the night. We're only off the streets, it's people who don't even get to go there. So off the streets is the last place that they are diverted to for the evening. Now, a family cannot stay together at MRM. The families have to be separated, right? Also, the MRM and the family shelter cannot provide services to house or sleeping services, if you will, to anyone who is handicapped. And so I think the other day, Craig, what you were talking, he had 3 handicapped people in one room on the low barrier side. We're talking amputees, people in actual wheelchairs. We have bathroom facilities, and the rooms are actually ADA accessible for those folks. And so we're not duplicating services. We're providing, there are different levels of services for the homeless throughout, but we are not duplicating, and we are not providing any of those program services that MRM do. What we're thinking is success, Mike. If we get people at the shelter to the place where they can go stay at MRM, we're counting that as success. We're providing that pathway to those services who can get people more stable and into regular housing programs. That's not the work of the off the street shelter. That's the work of programs like MRM and like the family shelter and like Family Promise. So we are not duplicating services in any way.
Thank you very much.
And I'm glad you called the neighbors. I'm really glad you called the neighbors.
Thank you. Councilmember Shaw, Neese, and Ronning.
Thank you. Quick question. First, I want to celebrate with you as well. Could not be more excited about this. Think it's fantastic. So needed for Billings. I know we're not talking about long-term strategy, and I echo Councilmember Ronning. I'm looking forward to seeing that strategic report. But my question is specifically about the crisis center. I live just 2 blocks from it. They are also a fantastic neighbor, but we have seen that they're also overloaded, right? So I'm curious about how that's kind of figuring into, is adding extra staff at the crisis center part of this $85,000 a month budget, or would that need to be an additional ask to increase the size there to handle the capacity just to do this diversion? Does that make sense?
Right. So a lot of those people are showing up there anyway.
Yeah.
We're actually providing the service by some of the crew at the off the street shelter will go there in the van that was donated to us to bring them then to whatever shelter they're appropriately need to be placed in for the night. The experience that the crisis center and the MRM and Craig, having been at St. Vincent de Paul, the experience that they have with some of the known homeless people here in town is, it's priceless. And people come in and out of crisis, right? You may be in crisis today, but you may not be tomorrow. And the next day, like Craig said, after a good night's sleep, they may be ready to enter into programming at MRM or the family shelter. And that's exactly what we want to do, Kendra. We want to provide that pathway into services.
Right. Yeah. Sorry, Patty, can so are you anticipating or thinking that that a piece of this might also need to be supporting that work at the crisis center? Or I guess what I'm asking is, in the last 2 months, have you really not seen a huge influx of more people? I think that's what you're saying. I just wanted to clarify. You're actually just being able to finally serve them. Is that really more accurate? Okay. Thank you.
And the other thing is that the continuum of care has been working diligently with the Montana Healthcare Foundation to to do something that would be like a combination kind of project, not for necessarily the low barrier shelter. We know that Matt's working on that with MRM, and we support that in full. So it's something different. Marcy's program at the Community Crisis Center, they are out of room, right? They've met capacity. And so anything we can do to alleviate that overflow there, like I think it was Craig or Cody who said, people are sleeping in chairs and then they have to rotate in and out, and we really haven't had winter yet. And so for 39 people to be at the off the street shelter on New Year's Eve, that was a big deal. That's a huge number, we thought. But yes, we're working very closely.
Thank you very much. Councilmember Neese and Ronning.
Thank you, Mayor. Boy, there's been a lot of good things said about this, Patty, and I'm cautiously optimistic to see how this goes. I share Councilman Yakowicz's concern in some respects. I'm hoping that summertime comes along, we don't see anything like we saw in other parts of the town. So I hope there's good oversight for that to ensure that doesn't happen. And so I just curious on the funding of this program. It was through the HBA, and so they bought the building, correct? And that was no city funds, correct? All this is being done without city funds. I guess that's where I want to kind of,
right.
Yeah.
Right.
So
the Housing Authority is a public entity. We are a public agency. We exist because of state law and city referendum. I don't know if you've heard me say this before, but there had to be a recount when the citizens of Billings voted for us to be in existence. And so we have several instrumentalities, Roy, that I'll talk to Chris about coming over and doing a full presentation to you guys, but that's why I offered some of those city bus tours. If you remember last year, I'm like, get on the bus, come take a look at really who we are. I think Penny thoroughly enjoyed visiting with some of our residents. Mike has been on our board before. He's fully aware of the complexity and how big our agency is, and honestly, the economic impact that we make. So HAB, so there's Housing Authority of Billings, which officially today, by the way, I'll announce this, we rebranded and we became Homefront Partners for a Better Billings. And so our legal name is still Housing Authority of Billings. And we have various things. So HAB Development is the development arm. It's the instrumentality of our mothership, if you will. And that entity purchased this hotel all using non-federalized funds.
Okay, but the funding source is what I'm getting at. The funding source comes from the state, the county. What taxing? They have to come from a taxpayer somewhere. So what taxpayer eventually funded the program of purchasing?
Well, it came from CARES Act. It came from CARES Act funding that was emergency funding only to be used for the specific thing.
And what was the purchase price? What was the purchase price of the building?
$1.6 million.
Okay, great.
Okay, thank you very much. Councilmember Ronning, and then I've got a question. Councilmember Ronning?
Thank you. I just wanted to comment on the duplication of services and get Craig and Patty's thoughts on this. So we have a significant problem in Billings when it comes to unsheltered. And I don't really see yet that we've run the course where duplication of services would be a really big problem. It seems like we need more of these types of services, not less, until we can actually say we've reduced the systemic issues related to the type of challenges that lead to being unsheltered. Could you comment on that a little bit? So thank you. And thank you again for the dignity that is being given to the human population that we're discussing here, because that's ultimately what's going to be the biggest part of lifting these people up. So thank you.
Thank you, Councilman Ronnie. I'll start first. One of the things that we heard loud and clear from city leaders in all of this and different community members is that the data was going to be very important. And so having all of the partners participate in that collecting of the data and then being able to share that information so we can present it all back to you is so important. So we're using something called the Homeless Management Information System. where everyone is being assessed. But we need all partners willing to do that assessment, to put that information in, because I think Craig will refer to them as the Sixth Avenue group or something like that. There's a whole group of people still that are not being, they're still choosing to be on the streets. And so, you know, we need as a community to do a better job of doing that outreach. I would love it if we get to the point in this community where we're fighting over serving the homeless people. I mean, how awesome would that be, right? It's not going to happen. We'll be able to identify more homeless people. And as they become more trusting because they are being treated in a very dignified way and being respected, I think more of them will engage in that pathway to services. You know, I have family members very much in a situation like you've had, Penny, and you know, it's awful. It's awful as a parent wondering where your child is sleeping for the night, right? And or if they're still going to be alive in the morning, you know, when you're going to get that phone call. So I was always happy that the jail was housing that child of mine for the night, because I could get a good night's sleep that night knowing that they were okay. And how sad is that parents have to have that thought. Cody has some other exciting news. Cody, can you share that about with the jail? Can you share that or no?
I'm not sure.
We'll hold off on that, but thank you for the teaser, Patty.
Craig will have some more thoughts on that, Penny, on, you know, some different things, but there's, you know, I mean, MRM is doing an amazing job providing the services for people who are ready to receive those services, right? But there's always going to be that gap that isn't ready yet. So how do we get them to the place where they're ready to enter into that pathway for services? That's what Off the Streets is.
Thank you very much, Patty. I'll have a question, but just a word to our council members. We're at 7:20. We usually try to take a break around 7:30, so we'll try to finish up our questions and open up for public comment in just a minute for anybody who wants to call that number, 237-6196. A quick comment and then question. The Rescue Mission has been mentioned a couple times. The Montana Rescue Mission has been a tremendous asset in our community for 70 or 80 years and caring for the homeless population when they were the only game in town. They're now engaged in a major redevelopment of their campus to create the unified campus. For any members of the public who might be watching, it's going to be a heavy lift financially. $13 million. They've got about half of that, but they're still going to be needing the rest of the community so that they can provide even more services, including services similar to what we've heard about tonight. So that's the comment. The question for anybody who wants to answer it, who might have been listening, I didn't see St. Vincent on the list of continuum of care participants. They've been a tremendous resource in our community of charity care for hundreds of thousands of people probably over the years. Was that just did I miss that, or was that an oversight? They've been a great partner with the Crisis Center. I don't know whether Patty or Cody or Craig can just comment on that.
So yes, they're a huge partner. So keep in mind, there's the COC membership as a whole, but this low barrier work group is just a small group of those members who could dedicate, I mean, it was hours and hours and hours of time. And then, you know, we decided as a work group that you could only be part of that group if you started, because we were working so many hours, making so many decisions, all by consensus. You couldn't have others drop in. So absolutely, St. Vincent Healthcare is one of our partners. As a matter of fact, they just gave us their mission fund, just gave us a grant. They actually gave it to the Housing Authority, but we are putting that over to this project. So huge partners, both Billings Clinic and St. Vincent Hospital. Yes.
Okay, thank you. They've also had a little thing called COVID-19 going these recent months. It might have been a bit of a distraction there. Any other questions for our presenters, for members of the council, before we open it up for public comment to that number, 237-6196. If you're listening, why don't you go ahead and call that number while we take a final question or two. 237-6196 if you'd like to comment. Councilmember Neese.
Thank you, Mayor. And I'm glad you brought that up about the rescue mission. I just wanted to clarify with Cody, because early on in your presentation, you made some comments that kind of made me second guess what you said, that the Montana Rescue Mission wanted their name removed from everything. And so are you saying that they pulled out of the continuum of care? Is that what can you explain really what the relationship the rescue mission now is to the continuum of care?
I can speak in regards to the low barrier shelter. They just wanted their name removed off of the low barrier shelter portion.
Okay, so you were talking about them not participating in this study group on the low barrier shelter, not the continuum of care.
Right, and I'm not sure Patty's the COC chair, so I wouldn't know if they pulled out of the continuum.
Okay. I just wanted to clarify that comment because it almost sounded to me like they pulled out of the COC altogether, but it was just a study group that they really didn't just participate, just like St. Vincent didn't participate.
Right.
Okay.
So,
all right. Thank you for clarifying that.
Councilman Neese, can I clarify? MRM was a part of every single one of those planning meetings with the low barrier group. It was after this facility was up and running that we just had a meeting, and I forget the day, that they asked for their name to be removed from all of the materials that we use talking about the off the street shelter.
Okay, but they're not pulling out of the.
I that you would ask. I think that you need to ask MRM those questions because I don't want to speak for them.
Okay, but as far as you know, they're not pulling out. They haven't pulled out of the continuum of care group.
Again, you're going to have to ask MRM those questions.
Okay. All right. Thank you.
Thanks.
Okay, thank you very much. That number again was 237-6196. For any members of the public who would like to comment on this item number 3 that we've been discussing tonight, the emergency low barrier shelter and the continuum of care. 237-6196. Ask that you keep your comments to less than 3 minutes. Tell us your name and address, and please mute your television or your computer. While we're waiting for those calls, Councilmember Purington.
What are ESG funds?
They're called they're emergency shelter grant funds.
Okay.
And there's a certain amount of that comes into our community normally, but with the CARES Act and with COVID, there was additional funding that could come into our community only for specific services like what we're doing at the off the street shelter. So, and it has to be non-congregate care that they're focused on, not congregate care. And it has a sunset. You know, those funds have to be used by, I forget what the day is of 2022, but yeah, we're not competing. There are no other agencies in town that could be eligible to receive those funds. They can't be used to build or buy or any of those things. So,
okay, Councilor Purington, follow up.
Just a quick follow up with this low barrier shelter, and you paid $1.6 million for the motel. Then you obviously have other plans after the year to use that for something else.
We do not yet. The Housing Authority hasn't received any funds from this project for allowing the group to use this. We are, it certainly could be used if the strategic planning pans out for maybe some transitional housing or some different things that we're seeing. What we've heard from the other service providers, Councilman Purington, is that there's a piece between people who are in a shelter, but then who don't really have the means to live by themselves and who really need to be around other people a little bit more because of their mental health situation, where maybe some transitional housing where they can't, or don't have to maintain a full apartment by themselves. There is that group of people. And I've been contacted by several people. They're like, the minute you're done doing this low barrier shelter, we'll take 20 rooms or we'll take this. I mean, it's a huge need in our community. We didn't realize it was this much of a need, but my board has not made that decision yet. And it will be my board's decision that makes that.
Okay, thank you very much. We do have some callers to the number 237-6196. Denise.
Yes, thank you, Mayor. I have a caller on the line. Hello, thank you for your call. You've reached the public comment period for tonight's City Council meeting. I'll give you 3 minutes to give us your comment. And may I have your name, please?
Yes, my name is Oksana. It's OKSANA.
Okay, Oksana.
And
your last name?
You said you need. My last name is Sheehan. It's SHEEHAN.
Okay. And did you want to give us an address?
Sure. It's 1714 Giants Way, Unit 1.
Okay.
Billings, Montana 59101.
Thank you so much. All right. The council is ready to hear your comments. Go ahead.
Great. Hello, thank you. My name is Oksana. I'm the program director here at Montana Rescue Mission. I just want to clarify a couple of things. Just earlier this year, the crisis center were sending vans full of people to us just every night, but they stopped when Off the Streets opened. Also, to clarify, we do allow for families to stay together. The only barriers that we have for the emergency shelter are the same barriers as Off the Streets. We are unable to serve sexual and violent offenders and people with animals. While we have been present during some of the continuum of care meetings, we are not on the leadership team and have no say in anything they do or plan. Additionally, I would like to point out that earlier this year, before they opened, we were providing quarantine and in isolation to our guests of the shelter in some of our private rooms that we have on our property when there was nowhere else for them to go. And there is definitely duplication of services and no referral process between Off the Streets and MRM. Thank you.
Thank you, Oksana. Hello, and thank you for your call. You've reached the public comment period for tonight's City Council meeting. You'll have 3 minutes to give us your comment. May I have your name and address, please?
Russ Fagg, 3053 Thousand Oaks, Billings, Montana.
Okay, go ahead, Russ. Go ahead. Give us your comment.
Okay. Good evening, members of the council. I just wanted to say, first of all, I appreciate the work that you guys do for the city, and I very much appreciate the heart that the continuum of care has for the city and the homeless in our city. And so I don't want to infringe on that. Just wanted to point out a couple of things that does concern me. First of all, as a neighbor, we have not seen any significant problems. The 7 to 7 has worked out very well. We've had a little more foot traffic, but we've not seen any significant problems. And so Councilman Jakowicz is correct in that. And we appreciate what Craig is doing to make sure that is the case. What I would encourage the council to do as this moves forward is to look at the movie Seattle is Dying. I think it's a real concern when we just give things to people with no accountability. And I'm concerned about the fact that the taxpayers are spending $1.6 million for this property. And then when we had the Good Neighbor meeting, and I very much appreciated the Good Neighbor meeting that Patty and the crew put on, they told us that they were going to spend about $150,000 a month in ongoing expenses, which again is coming from the taxpayers through the federal government. So that's about $1.8 million that will be spent in ongoing expenses over the next year. And I was super surprised when I learned that, as Patty just mentioned a minute ago, they have no plans for what's going to happen beyond a year. And so when you talk about that kind of money with no plans beyond a year, I'm just really concerned that we're going to continue to make choices that in the long run are actually hurting these folks that in compassion, the continuum of care is trying to help by just giving them a bed with no accountability. And there may not be so-called duplication with the Montana Rescue Mission, but I have a strong feeling that the money could be better spent if we supported the Montana Rescue Mission and the new campus that they're putting together. Those are all the comments I had. I appreciate what people's hearts are, appreciate the continuum of care, and I know they're trying to do the right thing. But I think in the long run, if we're not careful, we're going to run into a Seattle situation. and that's not going to be good for the citizens of Billings, Montana. Thank you very much.
Thank you. Hello, and thank you for your call. You've reached the public comment period for tonight's City Council meeting. You will have 3 minutes to give us your comment. May I have your name and address, please?
Catherine Card, 2815 4th Avenue South in Billings.
Okay, go ahead, Catherine. We're listening.
Hi, thank you so much, Craig and Patty and Cody and others that have worked so hard on getting this started. I so appreciate it. And Craig, you and I have talked a long time about the need for this kind of sheltering. And I'm so glad that you were able to, with Patty's help and others, to get this going. My experience when it comes to the need for this is based on volunteering for a year at the crisis center and seeing how much they can get overloaded. But also my experience of helping to put together the My Backyard program that was formed very quickly after November 2018, when the MRM no longer accepted a lot of folks. And suddenly the crisis center and others were forced to try to do something to handle all these people on the street. And so a group of us volunteers gathered together and a program was put together to manage that. But that was done in response to the pulling away of services by MRM. This sheltering that's being done now reflects the best of what My Backyard was able to do too. And my experience there was sitting up at night, many nights with folks, was that yes, sleep came and there was not trouble at all, and the appreciation, as Patty said, or as Patty said and Penny said, they deserve, the homeless, are us, and they are families, and they're our friends, and they in fact do deserve shelter, and they deserve safety and help and some of the basic things for survival. They deserve that every day. One of the things that I am wondering about is people don't seem to be sheltered from 2 in the afternoon until 7. And that there's give and take there, but I'm wondering what's being done to provide some day sheltering for folks, and who might be working on that. And I also just wanted to comment real quickly about the concern for public funds. When we don't house the homeless, when we don't care for the most needy people in our community, one way or the other, we end up paying for it, whether it's direct funds from a budget, or whether it's our price of healthcare raising, or the incidences of crime, or deaths on the street. We end up paying for it anyway. So we might as well really support in funds and in encouragement these programs that are trying to house the most needy and provide for the most needy among us. Thank you.
Thank you, Catherine. Hello, and thank you for your call. You've reached the public comment period for tonight's City Council meeting. You'll have 3 minutes to give us your comment. May I have your name and address, please? Hello? Hello?
Hi, this is Matt Lundgren, 2902 Minnesota Avenue.
Okay, Matt, we're ready. Go ahead.
Yeah, hi, this is Matt Lundgren, Director of the Montana Rescue Mission. I appreciate the work that Continuum of Care is doing, and we are still very much a part of that Continuum of Care. Just want to clarify that so there's no confusion there. And we are still a part of the work group for this off the streets effort, and still trying to engage and try to figure out best solutions from our community. And while we may have philosophical differences with practices, we're still very much involved in the homeless arena. In fact, our work that we presented to you about our unified campus, Your Honor and Council, is really very much going to address these needs that we are addressing now with our emergency shelter services, but also on a long-term basis, where we're providing not only respite rooms, but emergency shelter, and then more stabilizing shelter, and then permanent apartments. So we really have a model in mind where we can deliver all these services on one campus. And happy to hear the shout out from Mayor Cole about that. And the good news is now we have reached 3/4 of our goal. We've raised about $8 million of our $12 million goal to create this campus. So very excited about that. Very excited to provide these services to Billings. And just want to say that, like I said, for over 75 years, we've been providing services to the homeless, and we very much are in the day-to-day operations of working with the homeless in our community. On any given night this year, we have served over 100 homeless guests, over 100, and we've served over 2,000 unduplicated individuals. So we're certainly, in the fray and in the mix with this, and we feel very excited about the opportunity to go forward with our new campus. And we appreciate the work that Off the Streets is doing, and we look forward to the day that this effort will end, the pandemic will end, and we can get on with the business of transitioning people out of homelessness and into being fully housed. Thank you very much.
Okay, thank you, Matt. Okay, Mayor, it looks like we have reached the end of our callers.
Okay, thank you very much to our callers and to the council and to our presenters. A few last words before we take a break here, Councilmember Ewell.
Thank you, Mayor. I don't know who can answer this question, but anytime a project gets started or is put into process, if it's publicly funded, I would like to have kind of a gauge to see if it's been successful, if it's been a failure, or if there's been no change. So how can you determine whether this is going to be a success or not, or no change? Is it going to help the downtown area? If there can't be there during the day, you've still got homeless, panhandlers, street people running around downtown during the day. You just take them off the street at night. So are we gaining anything for the taxpayers, whether it's local taxes or federal taxes? It's still taxpayer money.
I don't know who would like to try to answer that, but Patty Webster, you're still got your screen open. Why don't we give you that word? Patty, you're muted. Sorry, Patty, you're still muted.
Okay.
There you go.
Can you hear me? Sorry.
Yep,
Thank you,
that's good.
Councilman Ewald. So first of all, there were no public funds used to purchase this hotel. The Housing Authority of Billings used all non-federalized funds. We have business entities where we make and generate income. So there were no public funds used to purchase the hotel. I've said that about 500 times, but wrong information keeps getting brought up at public meetings. Where the public funds are coming into play is that because of the pandemic, and only because of the pandemic, there was specific CARES Act funding that was filtered through the ESG program. So there was like a HUD, and the Housing Authority was not the recipient of those. It's the HRDC offices throughout the state. That money is given to DPHHS at the state level. From the federal level, can only be used for specific things in this CARES Act. As you all know, the pandemic offered a lot of money into communities, but those funds could only be used for specific things. So none of this money that is being used is money that could be used to support the MRN Capital Fund building campaign or any of their operations. So I just want to clarify that. We're not competing with the MRM. We only want to partner with the MRM. Like I said, Matt was at every single one of those low barrier work group meetings. He just asked that his information or the MRM name be taken off of any of the materials that we use when presenting presentations to different groups. So we're definitely partnering with Matt, like he said. I'm not sure why his program director made the comment she did, but so again, no public funds used. We aren't duplicating. Matt's serving still a huge number of people at the rescue mission and the family shelter, and they're doing a great job with that. The people we're serving, we're trying to get them into those services so that they can make that next step to that pathway of services. So again, it's not, no public funds used to purchase the building. That's the Housing Authority of Billings, HAB development entity. And it will be that board that makes the decision on what to do with this building afterwards. Just like it's their building, they own the asset. They'll make the decision.
Okay, thank you very much, Patty. This is a good opportunity for our break. Members of the council, it's 7:44 now. Let's try to come back by roughly 7:50. It'd be about 6 minutes. Again, to all of our presenters, everybody working on this project, members of the community, thank you very much. Keep it up, and we'll look forward to another report as we go down this path. Thank you very much. See you in about 6 minutes.
Getting better.
Thank you.
Okay, it looks like all of our council members are back with us. We will reconvene then. Hope everyone had a great time during your 5-minute break. We're back then at our this work session on January 4th, 2021. We are now on our fourth and final item listed, the Castle Rock Park Master Plan. Michael Whitaker, the director of our Parks and Recreation department, is with us. And also I see some other presenters, Dayton Rush with CTA, or as we once knew. And so we'll turn it over to Michael Whitaker to lead the discussion. Michael, it's all yours.
Well, good morning or good evening, Mayor and Council. Dayton Rush and his team from Cushing Terrell will present the Castle Rock Park Master Plan tonight. Staff is also here to answer questions. I would also like to add that Dayton also served 4 years on the Parks Board. So he's also a resident in Billings. So Dayton, you want to take it from there?
Sure. Thanks for the introduction. Like you mentioned, we have a couple more people here on the call tonight too. Wayne Freeman is our landscape architect and principal in charge of this project. He's on the call, and Stephanie Donovan is also on the call, and she's also a landscape architect who's been working on this project. So what we wanted to do is we want to just give you a quick update on where we're at with this master plan, answer any questions you have. We've gone through a wonderful community engagement session over the last year. It's been a rough year to do it, but it's been a great year, and just a lot of really great information and feedback. Not sure what that is popping up on my screen is. Hope that's not me. Okay, sorry about that. So I guess what we wanted to tell you is we have concluded our master planning process with our community engagement portion. And how we handled that this year was all virtual. And we started with specific stakeholder meetings with everyone we could think about who might have a stake in the Castle Rock Park, including people who have recently pulled permits over the last couple of years, people who live nearby, businesses nearby, the business community in the Heights, specifically especially the Heights Task Force, reaching out to them for their help all throughout this project, getting them to help engage other people within the Heights. And we've really started with all those meetings. We listened, we charretted together in multiple virtual charrettes, and then we vetted this concept through open houses, through a task force meeting, and just last month at the Parks Board meeting. And now we're here at the City Council work session. So the way that we've been handling this all virtually is we've been really using a website that's hosted on the Billings Parks and Rec website. There you can get specific information about this master plan. We continue to update it throughout the year. And the first thing you saw when you logged into our website was a video that we constantly updated with more and more information as the year went on. So what I want to start with tonight is just that recap video. So hopefully everyone's volume is working and we'll be able to play this. It's also available, like I said, on our website at billingsparks.org if you're having any audio issues and you need to go watch it on your own. So I'll start here. Sorry about that. I have to restart it. We have an issue. Okay.
How can we enhance Castle Rock Park for the entire Billings community to cherish for generations to come? Before any park development can take place, local government policy requires a master plan process. Design consultants work with park staff to host 2 public input sessions, where Billings residents give feedback on a draft park design. An updated master plan for Castle Rock Park will be like a roadmap for adding new amenities and features, as well as improving what's already in the park. This 25-acre park in Billings Heights currently has large open playing fields, tennis courts, a splash pad, and a pond, with much opportunity to expand. An updated master plan would better suit the needs of both today's Heights neighborhood and the greater Billings community.
Castle Rock Park has been left partially complete for decades, and it's time for a new vision. I'm Jennifer Owen, Chair of the Heights Task Force. We are excited to join with the City of Billings to involve the community in designing an innovative Castle Rock Park that benefits the Heights and all of Billings.
Through public input sessions, neighborhood meetings, and an online survey, feedback about the park and its future were gathered. What have we heard? We heard that adding a destination playground for all ages, a neighborhood center, and indoor pool were the most popular requests. Winter activities, a community event space, shaded picnic areas, and walking paths were also mentioned several times as a need for the Heights neighborhood. From an online public survey, we heard from nearly 400 people. Participants voiced their interest in developing a park that could host a variety of community events for all ages. Existing amenities such as the splash pad, grass fields, sledding hill, and walking paths are neighborhood favorites and should be preserved and expanded. The existing playing fields were found to be highly valued in the community since the quantity and access to playing fields are limited in Billings. New and unique features with the highest trends in the survey were a playground, indoor swimming pool, sheltered event space, and a climbing boulder. There was a strong preference for the park's natural features to inspire new amenities to celebrate the unique location and neighborhood of the park. Common themes regarding mobility and parking are that crosswalks and plentiful parking are highly desired, especially during community events.
I am Mike Whitaker, Director of Billings Parks and Recreation. We have logged hundreds of comments and received input from over 500 Billings residents that took the time to share their ideals for the future of Castle Rock Park. Public feedback from the listening session, online survey, stakeholder interviews, and public workshops called charrettes have been the foundation for the Castle Rock Park Master Plan. Through this process, we have also brought the City Parks Department, Parks Board, and Heights Task Force together with local user groups to lay a foundation for successful partnerships that will continue for years to come. The Billings Parks and Recreation Department, along with our partners, are prepared to start work on the master plan right away with an exciting destination playground that will serve as a catalyst for developing Castle Rock Park.
The proposed park master plan imagines 3 distinct clusters within the park: an active recreation cluster, an open playfield cluster, and a community cluster. On the west side of the park, the plan calls for clustering all the park's active recreation spaces. Users enter from the trailhead or from the newly enhanced parking lot. Adjacent to the parking lot is an entry gateway building with new public restrooms and a covered shelter. The existing splash pad will be preserved and expanded. Beyond the splash pad is an exciting nature-inspired playground with features that are uniquely Castle Rock. The playground will be further enhanced with benches, adult exercise equipment, loop trails, and a small covered pavilion. To build on the existing tennis courts, additional sports will also find a new home on the west side of the park, including a climbing boulder, basketball court, sand volleyball, and 6 pickleball courts, all connected with a loop trail. In the center of the park, the existing open playfields will be preserved and connected to the rest of the park and to the athletic facilities to the south with new walking loop trails, benches, covered shelters, and movable bleachers. On the opposite side of the park, an emphasis on community events and neighborhood amenities make up the community cluster. The master plan includes a neighborhood multi-use building for all season events, meetings, and gatherings, with space preserved for an indoor aquatic center. Near the existing pond, a new event pavilion and amphitheater is imagined while still preserving much of the hillside for sledding. And last, an extreme sport pump track with a combination of hard and soft surfaces for all-season fun with the whole family. The entire community cluster will be connected with pathways and further enhanced with benches, shelters, and public art installation. Thank you to everyone who took the time to contribute to the new master plan for Castle Rock Park. Together, we have ensured that Castle Rock will continue to be a hub for life in the Billings community and will be cherished for generations to come.
So that was a quick summary of our entire master plan document. The full master plan can be viewed on the website at billingsparksandrec.org. Just a quick recap. Some of those that public information, that public feedback that we gathered was through an online survey, but it was also during listening sessions and public charrettes that were held virtually. The feedback that we received is kind of well, shown a sampling of that is shown here on this slide. Really what the important thing to keep in mind here is that every single element that's within this master plan was really highly ranked with all of that public feedback. So nothing here is invented or made up. This is all directly from the public and what they've asked for and prioritized. So even the most desired element, such as the playground that's unique to the Heights, it's not only the first item and the centerpiece of the park, but it's also the first item being planned for construction this year with funding already. So the public feedback has been really important to shape this master plan. We started, so here's that final master plan that I was talking about. Up on the top, you can see earlier renditions of it that evolved as the public meetings went on. But a quick overview of what's in that master plan is this existing parking lot, which if you've been to Castle Rock Park, you're familiar with. This large gravel lot has a restroom and splash pad adjacent to it. We wanted to continue to build on that, adding a playground and the rest of the active amenities within the park, such as an expanded pickleball court, basketball court, sand volleyball, and climbing boulders all around this loop trail that makes up that active side of the park. We've maintained all of the existing multi-use field in the center. We've got a slide coming up here next that I'll show how that connects to what School District 2 has done with adding some multi-use fields. So it's important to keep that an important amenity for the Heights community. On the other side of the park, we've added really that community event space, those pieces that are certainly missing within the Heights community right now. And that is a built community center, but it's also an outdoor pavilion, similar in size to what's maybe considered or over at the zoo. So it's a large pavilion. It's not really a small picnic shelter, although we have some of those over there as well. That would be really the focal point of this park and available to the public most of the year. On that existing slope down to the water is a proposed for an amphitheater, and then keeping much of that for the sledding hill. The pump track here, that's an active local version of what you would probably call like a skate park, but this is really made for more of that kind of off-road, kind of Montana-esque version of skating. So it would be like the pump bikes and some of those larger wheel things that can get on more gravel and more terrain. So that would be an all-weather pump track right here, which would be another unique amenity for the Heights. Like I mentioned, it was really important that we merged with some of the progress that's happening out there by the school district. They've added 3 fields and some parking lots to the center of their property right adjacent to the fields at Castle Rock Park. We've also worked with them on creating a loop trail system that would provide a recreation loop on both properties. So just a couple of recap images of what you've seen in that video. The Castle Rock Park Neighborhood Center, the event pavilion space with market space and food trucks out in front of it, and then a destination playground really inspired by the natural features of Castle Rock Park. Oh, and then the last most exciting part, how do we fund it? Really important to think about a master plan is really prioritizing how we fund it with exactly exactly what the needs of the community are. And so we thought of this as the phase 1, these were the most important items to the community, and the phase 2 And then also thinking about future items. We also wanted to show how none of these items are really possible on their own to be done by the city, by themselves, or by the community by themselves. It's really a variety of funding sources that will build this entire park out. So what we've shown here is it's a kind of a gradient of where some of these amenities would fall within those funding sources, whether it be from public sources or from financial partnerships. Some of the other things you'll see on here is the items that are in bold are items that are maintenance items that are existing up there at the park that are in need of improvement. So we wanted to highlight those specifically as well. So that's my recap.
Very good, Dayton. Do you have any other comments from the rest of your team or Michael Whitaker, or you tell us when you want us to start hitting you with some questions?
That's all we have right now. So we're here to answer questions.
Okay, just to get the ball rolling, the phase one of the plan, and I just want to compliment you and your team and Heights Task Force Subcommittee, the Parks Board, members of the public, everybody who worked. I just thought it was an excellent plan, really well done. I think the video is very effective. So very comprehensive, critical that you do address the funding element to the extent you can. So job well done. On the question of funding, the prioritization was for that unique Billings signature playground area. The plan, I think page 42 or something like that, addresses that there once was a playground. What happened to that? Where was it? What did it look like? And how is this one different from what was there?
Michael, do you want to give us a recap of that one? Oh, you're on mute.
Mike, you're muted.
There was it was my understanding there was a playground at Castle Rock Park, and it was removed around 16 years ago. And the reason it was removed is because it didn't meet all safety standards and guidelines, and at the same time, they could not find parts to repair it. So it was removed. It was located over towards the school at that time. But the reason it was removed, according to our staff, is because of not being able to find parts. The proposed playground, my understanding is it's being called a destination playground because it is being located in a community park. So generally, your community park users will drive around 1.5 miles to the park. So it will attract people throughout the Heights and even from the center of Billings too. It will be a playground and scope that's similar to what you see at Pioneer Park and Castle Rock Park. When I say in scope, just on the play value, but it will be very unique and for the Heights. And they've expressed an interest to go more towards a natural type playground. Anything you want to add, Dayton?
No, I think that's a great recap of the history of the playground that was at Castle Rock Park. Any other questions?
Okay, thank you very much. Other questions from other council member? Councilmember Trakey?
Could someone fill me in on a little bit of the background on the swimming pool bond issues over the years? Were those bonds laid out for the so when you say the voters turned it down 3 times, was that the entire city, or was it parts of the Heights, or what are we talking about there?
Councilmember Cherokee, it was my understanding it was a citywide bond effort that failed.
Thank you.
Thank you. I can only see, I'm going to ask Dane to shrink your screen so I can see all council members, unless we need to, if somebody asks you to put it back up, we may ask you to do that though. Council member Joy.
Thank you, Mayor and Council. Very nice presentation. Very nice video. I have a question, and because I do know that previously there have been surveys that have been done in terms of recreation and park facilities within the city. And I just wanted to ask, in your survey, did you ask any questions about whether or not people would be willing to pay for these amenities, extra for these amenities? That was a question that has previously been asked in surveys, and it kind of gives you kind of judge the need, and you also judge or you have an idea of what people are willing to pay for. So was that part of the survey? Thank you.
That was not a question that was in our initial survey, but it did come up a lot during our public meetings, and people talked about what elements that they absolutely needed, and the pool kept coming up as a really high priority, even though everyone acknowledged that it would be a difficult item to fund. So it was probably more in our public comment period, or in our public meetings than in our survey.
Thank you very much. Other questions, Councilmember Purington?
I guess that's kind of my deal too, with swimming pools and splash pads. They're great for summertime, but such limited use, because of our short summers, and they are very expensive to operate. One of the other questions that I had though was on that pump track. Are you saying that it will have asphalt on it, that they could use it for skateboarding? We just had someone write us, I don't know, maybe right around Christmas, about additional skate parks throughout Billings. And I'm just wondering if that would preclude itself to that.
That's what we heard from the public, was that there was a desire to have just kind of a space where all those surfaces could be in one. I think there's another location in town where someone built an all gravel pump track, and it's just not used. It can't be used in all seasons, and it's just a little bit more limited. So this would be a pump track for really all of those different uses. So yeah, skateboarding would work out there too on some of this hardscape as well.
So it is asphalt?
Parts of it. So it'd probably be trails with gravel and asphalt.
Okay, thank you.
Hey, Dayton, while you're on that, maybe can you explain why a pump track is called a pump track?
That's a good question. I think the little pump, the bikes are called pump bikes because you power them with your legs. So it's non-motorized little terrain park, I guess.
Okay.
I hope I got that right. No one's shaking their head at me.
There'll be an opportunity for public comment to set you straight.
I hope so.
Councilmember Ewald.
Thank you, Mayor. I guess if we get this passed, this plan, and the CPI, if we follow, or CIP, if we follow through with it with the $1 million, 500 for 1 year and then 500 the following year, is the Parks Department going to bring forth a priority list of what is going to be done each year? Because that has to replace something that's already been there. Is that not right? Because it's PD1 money?
Yes, Councilmember Ewald, when we update the CIP, we will include the deferred maintenance type projects. But I did ask Dayton just to look at a couple projects that I think we should consider when we update the CIP. So Dayton, you want to pull up that slide and just highlight them?
So when we looked at that, we looked at what are items that would be considered deferred maintenance. And then we also went back and looked at what are the priorities that the community had with all of our survey and public information. And so the playground was definitely number one. And then close up with the playground and the amenity associated with the playground to make it more functional would be upgrading the bathroom structure that's right next to the playground there. If you've been out there, it's starting to get a little bit of wear and tear to it. Like no toilet seat or anything like that, but it could use some love. So that was one item that the community really wanted to see improved. And then access to the park as well. So upgrading those parking lots just for more efficiency. Right now on some of the busy days and busy events, it is hard to get people parked in there because it is just gravel. So those were the two big items that we wanted to focus on first were the playground and the parking lots.
Or the restroom and the parking lot.
Oh, sorry. Restroom and parking lot adjacent to the playground.
And the print is very small. Can you just give us the ballpark cost numbers on that, Dayton, on those three items?
You have that.
So these were some of those first ones. Let me move this out of the way. When we looked at that first parking lot, this is the one that's up on the north by the playground, and that would be 140 spaces. And to do that parking lot is around $300,000. And then the restrooms, we're basing the size of the restrooms off of the need of the splash pad nearby, since it does have some code requirements for that. So that's how we size that restroom facility. And to rebuild that restroom would be a $400,000 add. And so we just kind of based an approximation on what a design services for something like that would be and construction costs together to kind of come up with a ballpark for budgeting for what that first parking lot and restroom would be. And then the second parking lot is over on Nutter Boulevard. This is the one that's really used by those pavilions and that community side of the park. And this is a little bit smaller lot. It's 105 spaces, and that would be $267,000.
Thank you very much for more than $200 a square foot. I hope that bathroom has marble countertops and lots of dual shower heads or something like that. I guess that kind of construction doesn't come cheap, even though it looks pretty doggone basic to me. But
it does. It certainly has to stand up to a lot of wear and tear.
Dave, could you touch on the issue or the one thing that really impacts the cost is having to deal with the grades out there?
Yep. So if you're out there now, you'll see when you pull up on that gravel parking lot, you've got a pretty steep climb for that initial probably 15 feet that gets you up to where that splash pad and restroom building is. So one thing we'd have to do is import some material to get that parking lot raised up. And then the other challenge of building up there at Castle Rock Park is we're building on top of some really tricky soils. If you remember a few years ago when the tennis court was replaced, it was an asphalt tennis court that did not last very long. I think it was only usable for a couple of years from what I've heard from people talk about before it crumbled in place. So really we wanted to plan for making sure that we budget enough to build these facilities to last, even on some tricky soil and terrain.
thank you. Other questions? Councilmember Joy?
Thank you, Mayor and Council. I noticed that you had in one of your slides, you had kind of noted a public-private partnership or something of that type. Has any 501(c)(3) or nonprofit been set up, or any kind of communication of groups that would like to come together to fundraise for this park or anything of that sort? Thank you.
So yes, we've been working really closely with the Heights Task Force throughout this entire master plan, and they have some priorities that their members are really excited about to get started on working to figure out some of those funding sources that you mentioned. But we also learned through our public engagement process that there were organizations out there, such as the Pickleball Club, who were excited to just have their name on a place where they can start fundraising for. So we actually sized specifically for that group, and it was something that they were excited to start fundraising for. So we've heard from some some organizations that were out there and just desperate for space. Now that they've got a space in this master plan that they're looking forward to fundraising for.
Thank you very much. Councilmember Ewald.
Thank you, Mayor. The playground, that's funded and supposed to be going in this year. Is that not right?
Councilmember Ewald, you're correct. That playground will be going in this year.
It's going to be built according to the master plan.
We're going to use the master plan as a guiding document, but when we get into design, we'll work closely with the task force and the community as relates to the layout.
Will that also include the adult playground?
Oh, Councilmember Ewald, I wish we could include that, but I don't think we have enough funds to include the adult portion.
Okay, thank you.
Thank you very much. Other questions? Councilmember Neese.
Thank you, Mayor. I have to say the process that I was participated in was very good. I really enjoyed the ability, even though we were over Zoom meetings, they had the breakout groups that you could have your own little team members, and you can kind of have smaller groups work together, and then you all brought the ideas back into bigger groups. I think they did a really good job of involving the community in this, and the plan itself overall looks really, really good. I think they did a great job. There's a couple of things I maybe disagree on some of the funding. I think we talked about that during some of the meetings, how, you get clarify that this is not, the funding is it's a guideline. It's not necessarily a plan, that just because it says this is, fundraising by the public, that the public has to do this and the city can't participate. Although I think in your comments, you do say the public participates in everything. So I think we want to make sure that's clear in there. I like the idea of you doing that, and I hope the city takes that as a future for all plans, all park plans, to where they actually can kind of indicate what type of equipment is really city driven and what type could be more participating with the public. I think it's always good to get some public involvement if we can, and I think there's some good opportunities. I know the task force and some of the businesses up there were really excited about the event pavilion, and then of course that got taken out of the CIP. Part of their whole idea was to help utilize that to raise funds for additional parts within the park. So that's something that they'll have to rethink as far as some of their fundraising events. They were excited about holding community markets up there because with the whole COVID thing, we can't gather too much, so you want a lot of space and have some community events and markets and things like that. So the whole process, as you heard the different people talk about what they wanted, I think went well. The one thing I'd like you to explain, because we asked this and also future master plans to have this maintenance budget. Can you kind of go over that and explain how this is going to really impact the city budget? I know you didn't do dollars, I think FTEs or something like that, but can you explain what it is today and how much it'll increase as different phases happen?
Yeah, I'm going to scroll to these slides and I'm going to let Wayne answer, kind of walk you through that portion. I believe it's here towards the end.
Sure. This is Wayne Freeman. We took a look at each and every one of the items as to how we would actually staff this and how we would see that the projects were assured some level of maintenance, and we looked at it from a seasonal basis as well as elements that might be contracted out. But those still have costs associated with them. So ultimately, what we've got is a breakout of amount of staffing per. We looked at it from monthly to on a year by basis. So here you can see spring, summer, fall, and winter. We've outlined how this total park might be totally maintained during the course of a year. Hopefully that's going to help the park staff and plan for staffing, plan for what items might be might better be planned for some form of a consultant or farm out to an outside source. So ultimately, we've broke this down for each and every element.
Okay, a quick follow up on that, Mayor.
Sure.
So, and what you're saying here is like, so when the Parks Department brings to us a plan for the playground, they could not only bring the cost of what the playground physically is going to cost to put it in, but say this is what it's going to add to our budget, on a monthly basis, and we could be approving both a budgetary amendment if we wanted to, and the physical cost for it at that time. So we'd actually know what it's going to cost us to operate it. That make sense?
That is correct, yes.
Okay, great. Thank you.
Okay, other questions, comments from other members of the council? Councilmember Ronning.
Thank you. I'm not sure if this is a question or not, but first of all, I want to say, Dayton, of course, this is the second time that I've seen it and this presentation, and I fell in love with it the first time and think it's even more fantastic the second time I'm seeing it. So thank you to all of the members of the public that gave input, and to all at Cushing Terrell and your team that put this presentation together. So thank you so much for the work that went into this. I guess I have a question in regard to the Parks Advisory Board, and maybe this is more of a question to Mike Whitaker. How are we engaging the Parks Advisory Board in fundraising efforts, in coming to council with priorities and establishing those, and really advising council on how we can start developing funds for parks? Because I think this is one of those areas that we in Billings just need to become better at, is investing in our community within our parks. So we don't get in the situation that we've been in again with all of these parks deteriorating. And we've had some amazing plans come to us, and I'm really wanting us to be able to fulfill the funding for all of the different parks, because it's just so important for our community. So how is the advisory board functioning in the capacity of working with the Parks Department on these types of issues? Thank you.
Well, Councilmember Ronnie, I'll start off. As it relates to getting public input on projects, we usually start a couple months early on the CIP before the city starts, before other departments starts discussing projects. And that's a good time for the board to work through, and they'll have a recommendation of what projects should move forward with the funds we have. And over the last 2 months, the board has been discussing possible funding sources to bring forward to council. So there's been discussion going on at the board level for the past two months, and the CIP process is a good process to use to bring projects forward.
Okay, thank you. Kevin Eflin, Assistant City Administrator, you opened up your screen. Did you want to comment?
Maybe just a couple additions to what Mr. Whitaker said, Mayor and Council. The Parks Board, just like Mike said, looks at the big picture. We are working on, funding in general, for park development versus the maintenance side of it. And then the second part of it, and Mr. Kukulski can clarify, but there's a Parks Foundation out there that's really working on some of the partnerships and some of the funding mechanisms out there. And they're trying to revive and kind of relook at some of the things that they're doing. So that's in the works, aside from the Parks Board itself.
Yeah. Thank you. Other questions, comments? Councilmember Purington.
Thank you. So Kevin, that was exactly what I was going to ask about, was the Parks Foundation, if it is alive and well, looking for some outside sources of funding. And then one other question that I have that you can probably answer as well. We talked about a little bit with Landon's Legacy, these in-kind donations. Is that a viable option to cut costs within park development or even park maintenance?
So, Councilmember Purrington, the answer to your question is yes. The Parks Foundation is alive, and working on some fundraising issues out there. The second part of your question, as far as in-kind, yes. Certainly we're open to that and working, within the parameters that we have to do that. But yes, we'll certainly look at any in-kind, whether it be donations of material, work, or what that would look like. We just gotta, like I said, stay within our parameters, within the legal parameters of how we do that. And I've talked with Mike this morning even about Landon's Legacy on how we do that within projects, and make it, work well for, the city, the community, and then anybody that does want to, have some in-kind donations to projects.
So follow up, Mr. Mayor.
Please.
So with those donations that come in from fundraising efforts, or say there's just a group of people up in the Heights that want to contribute to Castle Rock. So do those funds, they go to the Parks Department and they set those aside for Castle Rock? How does that operate within the budgeting part of it? Where does that money go?
So go, Mike, if you want to answer it, you're certainly.
Yeah, Councilmember Puritan, we have several funds that if a group of people in the Heights would like to donate towards Castle Rock Park, we will work with finance and develop a fund, and all those dollars would go directly into that fund. And during the budgeting process, we would ask for the ability to spend those funds on Castle Rock Park. But yeah, those dollars will go into a special fund.
Thank you very much, Chris Kukulski.
The other piece I'd add is, Councilmember Puritan, you also have components. One of the things I think is really helpful about the master plan, and then ultimately start getting to that 30% design phase, which is where we're at with Poly Vista, is entities in the community can start picking parts of the park that they want to develop on our behalf. And sometimes they can stretch their money a lot further, not necessarily by donating it to us, but them saying, hey, here's part of the park we're going to build for you. And we're trying to draw that line, as clear as we can, that again, anytime there's public money involved, we're going to have to follow all the standard public processes for spending public money. But when private money is donating either in kind or cash to an entity, sometimes they can stretch it further than we can as an entity. So I would say it really is a hybrid of all those things. Some people donate to us, some don't want to donate to a group. And we're working our way through that, right? Billings has not done a lot of projects like this over the past many years. We frankly have really relied on either all one or the other. City's going to do this, or entity, good luck to you. Thank you so much. And I think we got to do more partnerships, frankly. I think the community expects us to do more partnerships. And I just want to put that plug in my conversations with the foundation. Are they alive and well? I would say they are very much wanting to they are alive. They want to be well, they're getting well, but they're saying to me and us, we want to partner in the city. We're not looking to be the entity that's going to build out all of your parks for you. We can't raise, tens of millions of dollars for you. So I really think their strength and our strength go hand in hand if we work collaboratively. And that's a lot easier said than done. And it's going to take some finesse on each of these projects, I think, for sure. So, but it really is good news, the kind of support we're getting. And I just want to put a plug in to thank Mike and his team for where we are tonight. So thanks.
Thank you. And just a reminder for any members of the public who might be watching, the City of Billings, any donations made to the city and the Parks Department qualify as charitable contributions, fully deductible. That's my shameless pitch. But also the Parks Foundation is a recognized 501c3 entity, qualifies for charitable contributions and deductions. Some of the task force do. The Southside Task Force, I know, does. Wouldn't be surprised if the Heights Task Force is also recognized as a 501c3, although I do not know that. So lots of opportunities if you're so inclined. Other questions, comments? This is a report, opportunity for input. There is no approval tonight. I'm assuming this will be coming back on a business agenda for formal approval in the future. Councilmember Neese.
Thank you, Mayor. That's I was going to ask Chris. Chris, when does this come back to us for formal approval?
You know, I don't have the date for you tonight. Tomorrow morning, we'll be going over the next several agendas. And based on the feedback, I would anticipate that we'd bring it back for approval within, 30 days, 60 days tops. Am I missing something there, Mike? Do we have a target date yet?
We will just move it forward as quickly as we can. I don't see anything that's going to slow down the process at all.
Any reason why we can't bring it to the last business session in January?
I wouldn't think so. Here's my first question back to you guys. Is it complete enough that it's on consent agenda? If it's on the consent agenda, then it should take minutes. If we're going to debate about a bunch of stuff that we haven't talked about tonight, then I need to make sure we have a half an hour or an hour to talk about it on a future agenda. So I'm not hearing changes from you guys. I would think it's a consent approval as soon as we can get it on an agenda, and that should be honestly within weeks.
Yeah, I would agree. The only, I guess, people from the public can call in on the consent agenda item at that time and just voice their support, as well as the emails that we're getting.
Absolutely.
Okay. All right. Thank you.
Okay, that's probably a good segue to our public comment opportunities. So let's open it up for public comment. If council members have further additions or questions after public comment, I'll certainly allow that. But now, for anybody who's been waiting, we thank you for your patience. Sorry that you've had to wait this long. But the phone number is 237-6196 to comment on item number 4, the Castle Rock Master Plan, the proposed version. That number again, 237-6196. Please call now. We'll ask that you keep your comments to less than 3 minutes. Tell us your name and your address. And please turn off your television or your computer or mute it, because our meeting is actually slightly ahead of what you're hearing. And it'll be very confusing if you still have sound coming out those speakers. The number again, 237-6196. We'll delay just a few seconds because of our the delay on the broadcast. Denise, please tell us if we have any calls to 237-6196.
Okay, Mayor, we received our first one. Hello, and thank you for your call. You have reached the public comment period for tonight's City Council meeting. You'll have 3 minutes to give us your comment. May I have your name and address, please?
Jennifer Owen, 906 Royal Avenue.
Okay, Jennifer, go ahead.
Good evening, Council. This is Jennifer Owen with the Heights Task Force. I just wanted to call in and echo all of the great praise that has been offered tonight by everyone. It has been a pleasure working on this master plan for Castle Rock Park with the Parks Department and with Cushing Terrell. There has been genuine community engagement from the start. We have been actively talking about this in the task force, and so very enthusiastic about the master plan. I'm sure you all received our task force letter in support, and we just really wanted to echo all the compliments that are going around tonight. Just a couple of things that I wanted to mention based on the discussion I've heard tonight, in particular in response to Councilmember Ronning's questions about the Parks Board. I think that, Councilmember Ronning, your question was structural. What is the Parks Board working on for parks funding writ large? But I did want to say, on a sort of a project basis, the Parks Board has been really an excellent asset for us in the task force in brainstorming fundraising strategies, answering questions about how we might do public-private partnerships, helping us to think innovatively about how we can be a good partner with the city. So on a small project basis, they have been a tremendous asset in addition to the work that I know they're doing much more broadly. And in that same vein, one of the things that I would urge council to consider as you look for ways, as the city looks for ways to be more innovative in working with the public and the private sector in fundraising, is thinking about how we partner together to work for grants. Perhaps there's chance for the task force or the Park Foundation to write for grants that maybe the city could provide the match for, and just really encouraging you all to think flexibly about not only how we raise money, but how we partner together as a community to go after some larger foundational grants, particularly for some of those big things in Castle Rock Park, like the community center, that we're really going to have to all kind of row in the same direction in, much in the same way we did on the Inner Belt Loop. So again, just want to take a moment to reiterate our thanks and support for this project, and thanks to you all for your commitment to these critical projects. Thank you.
Okay, thank you.
Any other callers, Denise?
Okay, it appears that
6196.
That's the only call we have.
Okay, thank you very much. We have received a number of written comments on this, all in support of the master plan by email, and those are always encouraged and welcome. So not hearing any other callers, we will go ahead and close the public comment period on item number 4. Council, is there anything else before we move on to council discussion relating to this item? We'll be looking for it to come back on the consent agenda or otherwise for formal approval in the near future pursuant to our earlier discussion. Don't see anything else then, so we'll move on. Are there any items of general council discussion before we go to public comment on non-agenda items? Councilmember Joy and then Councilmember Rodney.
Thank you, Mayor and Council. Considering what we have been talking about, funding and funding sources and grants, I don't recall our priorities list for our lobbyist in Helena, but the water conservation grants that we have used for our parks have been a tremendous source of funding. And we've heard that sometimes the water conservation grants, are not, that their funding may not be what it is. So I'm not sure how well we prioritize state funding for what we have available for state funding for our parks, but they certainly have been helpful. I do recall so many different projects where that was a source of funding for our parks. So, our lobbying priorities, and since parks are part of our priorities, should be incorporated in that some way. Thank you.
Okay, thank you very much. Any other items of general discussion? I might just, I'm sorry, Councilmember Rodney.
Oh, thank you. I was just, 2 things actually. So I just wanted to give a shout out again and a thank you to the Pretty Shield Foundation and the Rocky Mountain Tribal Leaders Council in regard to the 7 teepees. To the best of my memory, I don't recall anything being more photographed in Billings than those teepees. There were so many people that have photographed those teepees, and I think it was so meaningful to so many. And Mayor Cole wanted to say thank you for your presence there when the teepees were taken down, and really hope that we can have a further discussion with the Pretty Shield Foundation on making some type of a permanent memorial as part of a future conversation. And then the other question I had, and this is maybe for you, Mayor Cole, and for you, Chris, and I'm bringing this up now just simply because it's been a question on my mind, and I just hadn't really thought to actually come out and ask it, but has the press actually been invited to be a part of sitting in on the Zoom meetings, or are they just kind of relegated to watch from their computers or for their home? And I just ask that because these are open meetings and typically the press is sitting in our council chambers. So I just wanted to ask if there was ever that invitation that was in place for them to be having a square or not. I just wanted to put that out there. So thank you.
Good question, Councilmember Rodney. I'll answer that as best I can. And thank you for those comments. Absolutely well-deserved by the Snell family and Rocky Mountain Tribal Leadership Council and the Pretty Shield Foundation. Couldn't agree more with everything you said there. I've not been asked by any members of the press for any special access or a box on this Hollywood Squares game that we play. Rob Rogers for the Gazette, I guess, watches it over from the office. But if there were requests by any members of the media, we would bend over backwards to accommodate those. But I haven't had any specific requests. And Chris Kelsey put a thumbs up, so I guess he agrees. But it's always open. Let us know if we can help. On the issue of the funding, I just mentioned here that there's been a lot of discussion in the past of our need for a public information officer. I think the need through COVID-19 has made that abundantly clear. But one other thought that I have proposed in the past is if there's not enough work to keep a PIO busy all the time, and there probably is, but those are not skills that are completely different from a chief development officer. And it might be something that for the right person with the right skill set, we could task them with some grant writing as well. Even though a lot of those grants really need to be driven by the departments who are experts in parks, for example, or public works. But that type of position might be a good joint position with the PIO and more efficient use of public dollars. Okay, any other items of public discussion before public comment on non-agenda items? Not seeing anything. So members of the public, call this number if you would like to comment on anything that we have not discussed tonight that was not on our agenda, 237-6196, 237-6196. This is your last opportunity to comment on something that was not on our agenda. You'll have 3 minutes. And as always, we'll ask that you give us your name and your address and mute or turn off the television or the computer. That number again, 237-6196 for public comment on non-agenda items. Denise, I will talk very slowly to let them call in if they would like to. I'm not hearing one ringy dingy or two ringy dingies. So unless you raise your hand frantically, I assume there is no one who's called that number. And
that's correct.
Okay, so we will go ahead then and close the public comment period for non-agenda items then. And members of the City Council, welcome to 2021. I'm sure it'll be much better than 2020. Thank you for your service and good night.
Happy New Year to you all. Thanks.
Surviving a big bang, and not the big bang, but one that's big enough if you're too close.
Hello everyone at Quirks and Quarks. My name is Jordan Ayala and I live in Massachusetts. My question is, if one star in a binary star system goes supernova, what happens to the other one? Thank you for looking into this and happy holidays.
Here to help us with the answer is Nair Raza, a graduate student in astronomy